Thank you, and I'm going to introduce you to our beautiful guest speaker here. She's doing the first part on non-invasive testing for nutritional deficiencies. And this is Donna Wild, has studied, practiced, and taught holistic health to doctors and laymen for the past 30 years. She has studied nutrition extensively at Drexel University, Colorado State University, and the Lee Foundation for Nutritional Research. Ms. Wild has written, published, broadcasted, and lectured extensively on natural restorative methods for human and animal health. In May 2012, her book was released, The Skin, Tongue, and Nails Speak, Observational Science of Nutritional Deficiencies. Ms. Wild currently owns and runs Unique Perspective in Loveland, Colorado, where she has a private practice, works as a consultant, lecturer, and author, and lovingly tends to her organic vegetable and herb gardens. Let's give her a nice applause of welcome to Donna Wild.
Hello and welcome. It's my pleasure to be here today and share with you what I know about non-invasive testings and the nutrition to overcome these deficiencies. The tests that I'll be presenting to you today have been proven to be about 75 to 80% effective in their testing, which is about the same as any blood work or medical testing that you will be. So you can also use it to narrow down any other medical testings you feel is necessary by ruling out some of the ones that you feel you might also have. The majority of the information I'll be discussing today is in my book, The Skin, Tongue, and Nails Speak, Observational Signs of Nutritional Deficiencies. Its regular price is $29.95. I'm giving a special conference discount of $25. I'll be selling it at my booth in the exhibit hall, and then I'll also be doing the book signing tomorrow, but only the first session because I have to leave to get back home. The procedures on how to do all these tests can be found on my website, donnawild.net, and it's under the literature page, and it will give out how to perform all these tests. I'll be giving you a lot of information in my protocols. That doesn't mean that you need to do everything in the protocol. It's just covering all the bases. So what I would prefer that you do is just check to see what you feel that you need and maybe do what you need. I also, because I'm an herbalist, I put some herbs in the protocols as well. I won't have time to go over all the contraindications and interactions with you today. Actually, when I developed this presentation to give to you, it was 3 hours long, so I had to cut a lot out. So if it's not in the presentation today, it is in the book. But I do want you to check for all contraindications and interactions with any herbs or nutrition that you're using therapeutically. So the tests that we'll be covering today are Dr. Arthur Coca's pulse test for food allergies, the Candida saliva test for fungal and yeast infections, Dr. Broda Barnes' basal temperature test for hypothyroid function, the iodine patch test for iodine tissue saturation, Dr. Ragland's test for hypoadrenia function is what he called it. It tests for adrenal insufficiency. The zinc taste test to test for zinc deficiency, the calcium cuff test, which is the only known test for tissue calcium. You can get it for blood calcium. We'll also be testing for low stomach acid or hypochlorhydria, as well as tests for ulcers, gastritis, and we'll end, and again, this is over the 2 sessions, we'll end with acid-base pH testing and the importance of knowing what alkalosis and acidosis can do to your body. So let's start with Dr. Coca's pulse test for food allergies. He called it the pulse dietary technique. Dr. Arthur Koka was a medical doctor, an immunologist, a researcher, and a professor. And he wrote the book called The Pulse Test in 1956. This book is still available, used on the internet, so you can purchase it if you would like. But in his pulse dietary technique, he talks about how to test food allergens by isolating them in the diet and then testing to see if they cause an acceleration in the basal or resting pulse rate. And I'll be talking a lot about that basal test rate, and you always have to make sure you're done when you're resting and not when you're excited or nervous or busy. This test is very easy to perform. However, it requires a conscientious and discipline of the individual doing the test simply because of the amount of time that it takes and also keeping a journal. Because you need to keep an accurate diary or journal of the times you do the pulse testing and also the types of food you're ingesting. And you'll need to write down your resting pulse rate at certain times of the day. Dr. Koka said an increase in the resting pulse rate indicates an allergic reaction to not only a substance ingested, but also a substance inhaled. So how to perform this test is a day or two before you do the testing, you want to remove all those suspected allergens from your diet. And during that time, that day or two, when you're not eating any of the suspected foods, you need to take your pulse at certain times throughout the day. And it has to be, again, your resting pulse, so you need to be relaxed, take a few deep breaths, and calm yourself before you take your pulse rate. And it needs to be done for a full 60 seconds, not 15 seconds times 4. But it has to be done specific times throughout the day, and the first one is done before getting out of bed in the morning. And you want to be lying down for this test. And then you need to do it again before you go to bed at night. And then again 5 minutes before you eat every meal. And then 3 times after each meal at 30-minute intervals. So you're going to do it 30 minutes after a meal, 60 minutes after a meal, and 90 minutes after a meal. And you want to record all those readings. According to Dr. Koka, a healthy person's resting or basal pulse rate should only fluctuate between 2 beats throughout the day. Now remember, that's your resting pulse rate. If you're running, if you're doing any exercise, if you're busy doing something, your pulse rate's automatically going to increase. So that's why I keep emphasizing it has to be a resting pulse rate. And then on the day of the test, you're going to be doing the same thing. Before you get out of bed in the morning, you're going to take your 60-second read of your pulse. Then you're going to take it again 5 minutes before you eat a suspicious allergic food. When you do this, you need to limit your meals to one simple food. So if you think you're allergic to wheat, I would have you eat a piece of dry wheat bread or maybe a piece of dry wheat toast, because if you're putting anything on that toast, you could be allergic to that, and so that's why it needs to be kept to a simple food. If you think you're allergic to eggs, then just do a soft-boiled or a hard-boiled egg. If you think you're allergic to dairy, I would suggest just drinking a glass of raw milk, because a lot of the cultured foods and fermented foods, people aren't allergic to those. Some people aren't allergic to those if they are allergic to dairy. So I would say start with the milk first, and then you can go on and test your kefir and your yogurt and some of your cultured cheeses. Then after you eat that one simple food, you have to take your pulse again in 30 minutes, and then again in 60 and 90 minutes. You need to record what you ate and all of those pulse rates. According to Dr. Coca, an increase in the pulse of 6 or more beats after the meal indicates a food allergy or a food sensitivity. If there is no increase in the pulse rate, then there is no allergic food, and you can go ahead and introduce another simple food that day, or you can wait to the next day to introduce a new food. Dr. Coca also pointed out that a sharp increase of the pulse rate, 15 to 20 counts or beats, may indicate an environmental or an airborne allergen, such as exhaust, perfumes, petrochemicals, fumes, air funguses. Air fresheners tend to do this to people. And I've done this with a lot of my clients without doing the long, expensive food allergies, and we were able to isolate their food allergens. If you are going to do that big food test for food allergies, what they don't tell you is that you have to eat the foods that you're testing within a week of when you do the test, or they won't show up as an allergen. So just remember, if you do that long, extensive test, to eat the foods you think that you're allergic to. Where on the Coca's pulse test, you want to take them out of your diet for a few days. So let's talk what happens in a food allergy. Basically, an undigested particle of food leaks through the intestinal lining into the blood. This causes an increase of leukocytes, or white blood cells, as a cleanup mechanism. It's the body's natural response when it sees something foreign in the blood. Now you have these leukocytes and a food allergy, and then histamines are released, and inflammation can occur. If inflammation occurs, it initiates an anti-inflammatory response, releasing more white blood cells and phagocytes, such as IgE-coupled mast cells. In fact, if you do have blood work and they do an IgE, that's an indication in your blood work that you might have some food allergies. But the inflammation response will then elicit more neutrophils and eosinophils to come in and get rid of that inflammation. So with a food allergy, the typical first response tends to be gastrointestinal symptoms: abdominal pain, nausea, vomiting, indigestion, gas, cramping, diarrhea, acid reflux, bloating of the stomach and abdomen, and flatulence and burping. If it goes on for a long time, the secondary response tends to be more respiratory: an increase in mucus secretions, postnasal drip, congestion, and sneezing are just some of them. The third response is a skin condition, such as acne, itching of the skin, sneezing, rashes, and skin diseases. And what I find is food allergies can really exacerbate skin conditions such as eczema and psoriasis. However, what we need to keep in mind is all that excess mucus secretions, any vomiting, any diarrhea you might experience after eating a food allergen. That's the body's way of trying to get that allergen out of your system very quickly. So don't be concerned if that happens. Unless it happens over and over again, then you really got to get rid of the food. Now, food sensitivities are a little harder to discern that they're coming from food because they could be from a number of different conditions, such as acne, arthritis. In fact, arthritis is a cooked food disease. Give up the packaged foods, the canned foods, the fast foods, and go on a 60 to 75% raw diet. And within 3 years, most of the arthritis symptoms will go away. Diarrhea is another symptom of food sensitivity, as well as abdominal bloating and pain, fatigue, headaches, itchy, watery eyes, nasal congestion. It affects your memory and concentration, so you're not as acute. Repeated colds, sinus infections, and inner ear infections. And it's amazing that the allopathic doctors will give you antibiotics for ear infections, and what they're finding out are most cases of ear infections are actually fungal infections. So you have to get rid of the yeast or treat them like a candida. The antibiotics really aren't going to work. In fact, they're going to make it worse because those antibiotics kill the bad bacteria as well as the good bacteria in the body. Also, any swelling or fluid retention is another sign that you might have a food sensitivity. So, what are the most common food allergens? The 4 that I always test are wheat, corn, soy, and dairy. But you can have a gluten allergen, and gluten is found in more than just wheat products. You could be allergic to eggs. Shellfish is very common in seafood. A lot of times it's associated with an allergy or an allergic reaction to iodine. Peanuts, but mostly because of the way those peanuts are handled after they've been harvested, and they tend to get a lot of mold and fungus on them that people are reacting to. Vegetables from the nightshade family, such as tomatoes, peppers, eggplants, potatoes, especially if you have arthritis. A lot of people with arthritis react to those. Caffeine's another common food allergen, and it can be found in coffee, tea, chocolate, a lot of soft drinks and sodas. These energy drinks that have so much caffeine, they stress out the adrenal glands and cause heart problems. And also some of the sports drinks have caffeine in them. Alcohol's another food allergen, and it doesn't mean all types of alcohol. Some people can do wine but not beer, but beer tends to have gluten, and so we'll work through those. As well as the food additives such as coloring and dyes and preservatives and flavor enhancers, especially MSG, and the artificial flavors that tend to be added to packaged foods. Now, it's not so easy to correct a food allergen because it takes multiple systems that it affects, so we have to work on fixing all of them. The first one that I look at is fixing digestive issues. Do you have low hydrochloric acid? Is there any gut dysbiosis going on, such as yeast, parasites, an infection of the bowel, whether it be bacterial or viral? All need to be addressed. Any case of leaky gut, if you have food allergies, you probably have leaky gut because the food particles are going through the intestinal walls and they were never meant to do that. We also have to work on the mucous membranes because there's mucous membranes that line the intestinal tract as well as our upper respiratory system. You'll have to go in and support the immune system because the body, being that it has all these allergies, its response is like an immune response. It's sending out all those white blood cells to clean up what's going on in the blood and around the tissue. We have to look at the inflammation and get rid of the inflammation. The best way to get rid of inflammation is eating a lot of good, wholesome sea fish that are high in the omega-3s, and also to balance your fats if you're not getting proper amounts and equal balance of your saturated fats, your omega-3s and your omega-6s. If they're out of balance, that could cause inflammation. And also eating a lot of fresh fruits and vegetables help get rid of the inflammation. You'll probably need to do some liver support simply because the liver has been overwhelmed trying to get rid of the toxins that are produced by your food allergies. We also need to look into the autonomic nervous system. The autonomic nervous system is fight or flight or sleep and eat and heal. And so when you have a food allergy, you tend to go into sympathetic dominance, which is fight or flight or being chased by a tiger, so they say. And we need to get you in parasympathetic dominance where you can sleep, eat, and heal. We'll need to look at the adrenal glands. You've been in sympathetic dominance for so long, it's now depleted your adrenals. And then we need to look at your pH and balance the pH, because people who tend to have allergic reactions or allergies tend to be too alkaline. So we'll talk more about that at the end of the second session. So the first things we want to do is remove the offending substances and any stress in your life. I can't heal people when they're under stress. It's very difficult. So you'll need to deal with your stress, and we'll talk about that when we talk about the adrenals. And we need to remove the offending foods simply because when you're under attack, it's very hard to heal. So if we remove that allergen, then it's a lot easier to heal you. The next thing we need to do is repair the gut lining and improve your digestion and support the integrity of the mucous membranes. And luckily, they take about the same nutrition, so you could do both 2 and 3 in one step. We'll need to support the immune system, the liver, and the adrenals, and again, balance out the autonomic nervous system and the body's pH. So to improve your digestive integrity, the first thing we want to do is eliminate or reduce the food allergens or intolerances, like I said, any sugar or refined carbohydrates. Most people don't realize just by eating sugar and refined carbohydrates, you can actually get a yeast infection. The same thing with chloridated and fluoridated water. It destroys the flora in the body, and we not only have flora in our digestive tract, but we have it in our sinuses, in our ears, on our skin. There's flora throughout the body. And what I've found are swimmers, especially like on a high school swim team, they tend to have the worst rashes and skin conditions because the chlorine destroys the flora on their skin. So I always have to treat them for a yeast infection. Pharmaceutical drugs can cause leaky gut, whether they're prescription or over-the-counter. Plus, they could cause some yeast infections. We have to look for parasites. What you may not understand is that parasites and yeast go hand in hand. Parasites give off an exotoxin that yeast can thrive on, and yeast gives off an exotoxin that parasites can thrive on. So that doesn't mean that if you have a yeast infection, you automatically have parasites, but I always test for them because in long-term, hard-to-resolve yeast infections, that might be a missing component. Of course, you want to eliminate genetically modified food. What they actually do is they inject viruses and bacteria into the genes of these foods, and they're very foreign to the human body. And we don't want those foreign bacteria and viruses in our system. Plus, genetically modified foods have been shown to have less nutrition in them, so you're not getting the nutrients that we need to heal the body. We've talked about stress and how that needs to be eliminated. Any toxins, whether they're in your diet or your environment, especially pesticides and herbicides. You want to reduce or eliminate your alcohol and any exogenous hormones. These are that you take internally, such as birth control and hormone replacement therapy. And progesterone creams are very popular, but progesterone creams cause yeast infections, and the manufacturers know that and don't always tell you. Strenuous exercise can reduce your digestive integrity, so any professional athletes will need to look at that. Any starvation, a poor diet, or prolonged fasting can cause a weakness in your digestive tract. We need to get rid of any infections, whether they're viral, bacterial, or fungal or yeast related. Vaccinations we need to be careful of because of the mercury and aluminum that they put in them. Gluten, because I'll explain to you what happened with gluten. Okay, wheat used to be good, and then they hybridized it, so they changed it. But it's not only the hybridization, because they hybridized it to have more gluten. Most wheat wasn't high in gluten, but you know when you bake and you want that nice leavening, the gluten helps with that. So they've hybridized the wheat to have more gluten, but then when they process the wheat, they deaminize the protein. Deaminization basically took the alcohol-soluble gluten that you wouldn't assimilate if you didn't have alcohol while you were eating and changed it to a water-soluble molecule. So now, besides our wheat having so much gluten in it, we're all absorbing it because it's now water-soluble, and gluten has been shown to cause leaky gut and put holes in the digestive tract. Not only that, if you keep eating it, it will actually affect the blood-brain barrier and cause problems with the brain as well. So we need to be really careful about gluten and maybe eating some of the older grains like spelt and farro and einkorn, and there's some other ones out there as well. We also have to eliminate thyroid insufficiency. Anybody with hypothyroidism, they basically are not metabolizing and digesting their food like they should, so we need to address that as well, and we'll be talking about that today. So, how do we repair gut lining with nutrition and foods? I usually start my clients out on a good probiotic and tell them to add fermented foods with every meal. I usually say just a quarter of a cup to a half of a cup, but 3 times a day I want you eating fermented foods, and then eventually I can get you off of the probiotic, and your fermented foods will help rebuild healthy flora. Vitamin A, C, and P. I'll be talking about a lot of vitamins today that the FDA no longer recognizes, but if you pick up textbooks from the 30s and 40s, all these vitamins are still in there. But vitamin P are now called bioflavonoids. And you need the A, C, and P to basically knit the tissues back together and create collagen to get rid of that leaky gut. I'm preaching to the choir here when I talk about bone broth soups, but they're so good for healing the intestines and also healing the immune system. You need to eat a lot of good protein so that you can produce new cells, especially glutamine. Glutamine has been shown to help knit the tissue back with leaky gut. Gelatin is another good source of protein and helps with the healing of the intestinal tracts. And if you're doing your bone broth soups right, and they basically gel once you cool them down, then you know you're getting plenty of protein. If your bone broths don't gel up when you refrigerate them, I would say put them back on the stove and cook them down a little more so that you do get that gelatin that we're looking for. You need trace minerals, at least 18 of them. I usually put people on digestive enzymes with or without hydrochloric acid, but the digestive enzymes will help you digest your food completely to take the stress off the intestinal tract so we can heal it. You might look at doing a food-based multiple vitamin because vitamin D and B6 are very healing to the immune system and the digestive tract. Also, you want to look at your essential fatty acids, make sure you have a good profile, but those omega-3s, especially the fish oils, are very good for fighting inflammation. Next, let's move on to that saliva testing for candida overgrowth. Because most times with leaky guts and food allergies, there's probably a yeast or a candida infection going on. So I say to do it first thing in the morning, but I can tell you when I work with clients, I have them do this any time of the day that I'm working to rule out a candida infection. But you don't want to put anything in your mouth before doing this. You want to have a clean mouth. And you want to gather a pool of saliva on your tongue and spit it into a glass of water. And you'll need to note the time that you do this. You then want to check the water every 15 minutes for up to 1 hour, and you're going to be looking for certain things. You're going to be looking for strings like legs traveling down into the water from the saliva that floats on top. Or if you see any cloudy specks suspended in the water, or if the saliva just sinks to the bottom of the glass, then the saliva is carrying a fungal overgrowth and is usually a systemic yeast infection. If there's no strings and the saliva is still floating on top after 1 hour, you can consider yourself candida-free. Other signs of yeast infection is the geographic tongue. They call that because it looks like land masses from a map. Then, left untreated, you get this thick white covering on top of the tongue. And then long term, I found there's no coating on the tongue at all. And you need a slight coating on your tongue to get good absorption. Also, thrush in a child, as well as cradle cap. No one told me when I had my children that cradle cap was a yeast infection. It was just something babies got. But yes, it is a yeast infection. Other skin signs are dandruff, athlete's foot, nail fungus, whether it's on the toenails or fingernails, ringworm, which we consider a parasite, is actually a fungal infection, as well as scabies for your animals. If your dog has scabies, they probably have a yeast or fungal infection going on. And then folliculitis, which is a swelling of the hair follicles, an infection of the hair follicles. It could be a yeast infection, or it could be a bacterial or viral infection as well. But this is very painful and causes the hair to fall out. Other fungal-related skin rashes or diaper rash, we consider that, more of the acid from the urine, but it's actually a fungal infection. And these rashes can show up anywhere on the body. They tend to be that raised red. They can itch, they can burn. A lot of women who have vaginal yeast infections will get it on their inner thighs. But I've seen it on hands, I've seen it on necks, I've seen it on abdomens. Not saying that all rashes are fungal related, but these specifically are. Other signs of yeast or fungal infections could be itchy skin, especially jock itch, gas and flatulence, abdominal pain and bloating, vaginal discharges, especially that thick white or yellow that may come out. If you crave carbohydrates or sugar, that's a good sign of a yeast infection, because I have to say, yeast is a living organism. It wants to survive. If you stop eating sugar and refined carbohydrates, yes, you're going to starve the yeast, but sometimes people fail in a candida protocol because of all that carbohydrate and sugar cravings. And that's why I start them on a probiotic, and I'll bring up a diet that I also recommend. Also, lactic acidosis. Lactic acidosis are those people that feel like they need to take a nap after a meal. That's basically a systemic yeast infection going on in the stomach and throughout the intestines. But you also need to take B vitamins to help with that, because the yeast eats up your B vitamins, and it's hard to get into the Krebs cycle to utilize your nutrition and turn it into energy. Also, what you're not being told is everybody who has cancer has a yeast infection. Medically known fact. So if you do have cancer, you're going to want to go on a candida diet, take out the carbohydrates and the sugars, and go on a good probiotic. Some of the probiotic supplements that are out there are your lactobacillus and your bifidus. These are actually bacteria. The next three are actually come from yeast, whether it's acidophilus yeast, mycelium yeast, or the Saccharomyces yeast. In fact, I don't know if you realize, but some difficult yeast and fungal infections, they have a biofilm around it. So they're very hard to kill. Actually, Myosaccharis boulardii, I believe is the name of it, is actually can penetrate that biofilm and get rid of and attack the yeast infection. Also, digestase enzymes such as lipase and protease help to do that as well. Some of the lacto-fermented foods I want you to eat are yogurt, kefir, buttermilk, sour cream, if you can do dairy. Kombucha is an excellent source, and you don't need to drink a whole bottle in one sitting. I would say drink that whole bottle throughout the day. Borscht and kvass are both fermented beets. One's soup and one's a drink. Your pickled vegetables, such as sauerkraut, kimchi, pickles. And as long as you don't have a thyroid condition, you could do the fermented soy, such as miso and tempeh, because the fermentation process will actually kill the goitrogens and nutrient blockers that are in the soy. Other considerations are herbs. Podiarco is a great one, and it's the bark. Devil's claw is a panacea herb. It takes care of yeast, bacterial, and viral infections. Most people are familiar with tea tree oil. Garlic is an excellent one. Eat 3 cloves a day and eat them raw. Vinegar, because yeast thrives in an alkaline environment. So if we use these lacto-fermented foods and these probiotics or vinegar, and I know in Dr. Cook's book, The Yeast Connection, he says stay away from vinegar and mushrooms. I think people react to vinegar when they have a yeast infection is because of all the die-off that's happening. So you basically need to acidify the digestive tract so the candida will not thrive and grow. And being in an acid environment, your good bacteria will thrive and grow in that. Also, caprylic acid's a nutritional supplement that will help acidify the gut and get rid of yeast. And then I like to give them sulfur. Sulfur is a great gut purifier and keeps the bowels moving as well. If you're on a probiotic and it doesn't seem to be working, look into a prebiotic. A prebiotic is something to feed the good bacteria of the probiotic that you're eating. These are pectin, and pectin is found in great quantities in crab apples. In fact, my grandmother used to use crab apples to make all her jelly, or put the crab apples in there because that's how she got her pectin. But also blueberries are high in pectin. And then slippery elm bark and marshmallow root. I have my clients mix the two together in a liquid and drink it down. And then the diets. Of course, the GAPS diet is excellent, but it's very difficult for people to stick to. And I don't want people to feel guilty. It's hard to heal someone when they feel guilty about things. So I started them off on my modified yeast diet, and it's basically reducing some of the foods very slowly over time, and then I'll switch them over to a GAPS diet once I got that yeast infection under control, because remember, when you have a yeast infection, you crave those foods that you shouldn't be eating, such as the carbohydrates and the refined sugars. And that modified yeast diet is found on my website under the literature page with all the other handouts for this presentation. And then we have the hard to resolve yeast infections. So we talked about the biofilm and how to penetrate that. But what most people don't understand is yeast is sexually transmitted. So if one partner has it, the other one's going to have it. You also have yeast in your mouth, so even French kissing could cause a yeast infection. And people that have a fungal infection, they brush their teeth, the mouth has a flora, there's fungus or candida in the mouth, and every time they reuse that toothbrush, they're reinfecting themselves. So what I recommend to my clients is to throw the toothbrush in the dishwasher and clean it, or just, soak it in a little hydrogen peroxide or white vinegar, and that will kill the fungal spores that tend to accumulate on your toothbrush. The other one, we know antibiotics can kill the bacteria and cause yeast infections, but most people don't consider or know that colloidal silver can do the same thing. So if you're doing either antibiotics or colloidal silver, I recommend a probiotic or eating those 3 servings of fermented foods throughout the day. We talked about chlorinated pools and swimming, but most water, unless you're on well water, is chlorinated. So you can get it from taking a shower, a hot bath, or it can even be in your hot tubs that you're soaking in. So what I recommend for my clients, you can get little water filters that go on the shower head that will take the chlorine out of the water. Or what I do is I like baths, so I draw an extra hot bath. Chlorine is a gas, and then I just let it sit for a few minutes, 10 minutes or so to cool, and then all the chlorine basically dissipates. Did you know that chlorine and fluoride were the gases used in the Nazis' gas chambers? And they put them in our water. They need to do the chlorine to purify the water, but they used to use iodine to purify it instead, which is probably a little healthier to do. We talked about parasites and checking to make sure you don't have parasites. Although parasites run in cycle, they become active and then they become dormant. So if you are going to test for them, they only show up when they're active and not when they're dormant. Chronic diarrhea can basically cause a yeast infection because with those loose bowel movements, all your flora is coming out. And we talked about hormone replacement therapy and how birth control and doing hormones for menopause can also cause a yeast infection. So let's move on to Barnes basal temperature test for thyroid function. And I know I'm going through these quickly, but we have 10 tests to go through in 2 hours, so we will be going through them quickly, but I'll be around for questions. So the thyroid gland basically sits at the base of the neck. It sort of looks like a shield, and its main function is to regulate the body's metabolic systems. One of its main functions to do that is to maintain a constant body temperature of 97.8 to 98.6 degrees Fahrenheit. Many of the body's chemical reactions, especially those involved in the utilization of vitamins and minerals and enzymes, are temperature sensitive. So if you're low thyroid, you're not going to be producing these chemicals so that you can utilize your nutrition that you're taking or eating. And if you have hyperthyroid, basically you have too much of it, and that's why people lose weight and have a wasting disease. However, Broda Barnes was a medical doctor, a physiologist, and professor of endocrinology. He did a lot of research on thyroid function and their related diseases in the 1950s and 60s. He actually practiced in Fort Collins, Colorado while I was going to school there. He believed that the body's basal temperature, remember that's the resting temperature, is a reliable reflection of the individual's thyroid hormone function that actually goes on inside the cell. It's hard to test what goes inside the cell when you're dealing with blood work. That only tests what's in the blood. But that thyroid hormone and that metabolic rate is responsible for the rate of oxygenation or the burning of your food for fuel. So if you're low thyroid, you're not going to burn your food properly, and you're going to have low energy as well and always feel cold. So this is a real easy test to perform at home. What you need is a mercury thermometer. I know you can't buy them anymore, but if you have a mother, a grandmother, an aunt might still have them in their medicine cabinet, you can ask them. Or you can get a fertility thermometer, because what I really want is a thermometer that would do a 10-minute read, and most of the thermometers are electronic and they turn off within 3 minutes. However, I've had clients that were so low, the low temperature did show up on those 3-minute reads. But you want to place your thermometer, a pad and a pen, or your Android phone, because you're going to need to keep records, and a clock by your nightstand before you go to bed. And you want to do this immediately upon awakening, before the body has a chance. If you have any nervous energy or any anxiety, it automatically raises the body's temperature. So, you want to shake down your thermometer, because it will be sitting at room temperature or warmer, especially if it's by a clock at night. It's going to get warm. You shake it down, and what you want to do is do an axillary read, which is under the arm, skin to skin, hold it down, and do it for 10 minutes. Then you want to record your temperature. I want you to repeat this procedure for 3 to 5 days and then average out the temperature. The normal basal temperature with an axillary read should be 97.8 to 98.2. If the temperature is lower, you can suspect hypothyroidism. If it's higher, you can expect hyperthyroidism. But there may be other reasons why there's an elevation in the body's temperature. If you have an infection and you're running a fever, of course the temperature is going to be higher. But menstruating women need to start this test on day 2 or 3 of their bleed, because when a woman ovulates, her basal temperature will raise 0.4 to 0.8 degrees Fahrenheit. It's actually a fertility test. And that's why I said get a fertility thermometer, because this is the way women used to know when they were ovulating. And then after ovulation, the basal temperature will remain slightly higher, not as high as when you're ovulating, unless you're pregnant. If you're pregnant, then that body temperature is going to stay up, and that's a way of knowing if you're pregnant or not. But you have to always do your basal temperature reads so that you know what they are. And then that slightly elevated temperature will go down again once the menstruation starts. Also, starvation or pituitary insufficiency could cause a low temperature reading. But Dr. Broda Barnes said although the basal temperature test is not 100% effective for all thyroid function, it's a simple procedure and it's remarkably successful in uncovering hypothyroidism. And I can't tell you how many clients I have worked with, their blood work and thyroid panel come back normal, but they have all the signs and symptoms of hypothyroidism. So I have them do this test, and I've had women come back where their basal temperature test was 3 degrees below normal, and it didn't show up on their blood work. And Dr. Barnes says it's almost 100% effective for showing hypothyroidism. And Dr. Barnes' book is still available on the internet. So let's talk a little bit more what the thyroid does. It produces thyroid function hormones, and the way that it does that, to make T3, which is your active form of your thyroid hormones, it takes one tyrosine molecule, which is an amino acid, and it binds 3 iodine molecules to that. To make T4, which is primarily your storage form of thyroid hormone, you need 1 tyrosine molecule and 4 iodine molecules to create the hormone. So you could see already that you need amino acids and iodine to have proper thyroid function. But the thyroid hormone is necessary for neurological development and function, and people with low thyroid basically tend to be slow thinkers. It increases the sensitivity of all the hormone receptors in the body, and as I said, it regulates your metabolism, which overrules digestion, your oxygen consumption, and your heat and energy supply. And that's why low thyroid people tend to have low energy, and they're cold all the time, even on a hot summer day. The thyroid also mobilizes fat from its stored adipose tissue. So if you're trying to lose weight, you definitely need those thyroid hormones. It stimulates growth and development, especially of the brain and the bones, and we'll get into birth defects caused by iodine deficiencies in the next couple of slides. And it's also necessary, the thyroid's necessary to keep calcium in balance in the body, especially in females. And I find a lot of females who are taking synthetic thyroid hormones that still get muscle cramping and Charlie horses. And what I tell them to do, and even though they tell you not to take anything with your thyroid hormones, I have them take calcium with it, and that helps stop those Charlie horses and muscle cramping that they would get. And the other important thing is that the thyroid overrules the gonads in the body, whether that's ovaries in women or testicles in men. And a lot of times when women cannot get pregnant, it's because of a hypo or hyperthyroid function. Also, what you need to keep in mind is the adrenal glands are the backup to the thyroid, and vice versa. So if the thyroid is low, the adrenals are going to rev up and compensate for it, and then your adrenals become depleted because of that. Also, if you're under a lot of stress and the adrenals become depleted, the thyroid overcompensates for that, and so after a while you become hypothyroid because of the stress as well. So a lot of times when I treat a thyroid condition, I add adrenal support into it as well. And here's Dr. Hauer's chart of endocrinology, so you can see how all these glands work together and are dependent on each other. Dr. Hauer was an endocrinologist who wrote a textbook on endocrinology in the early 1900s. But let's talk about some signs of hypothyroidism. We talked about the weakness, dry skin, lethargy, slow speech, feeling cold, a thick tongue, especially when you get those scalloped edges around the thick tongue. That means your tongue is so big it's not fitting in to the portion of your mouth that it should fit into, and those are actually teeth marks on the side of your tongue. Constipation. First look to a low thyroid. Swelling of the eyelids, the upper eyelids, not the lower eyelids. Decreased sweating, loss of hair, weight gain, especially around the middle. And the reason why it goes around the middle is it's putting on a fat layer to keep the body's temperature up. So you get rid of, you bring up your body temperature with some thyroid support, and you'll lose that weight that typically goes around a low thyroid person. Hoarseness of the voice, menstrual cycles that are painful and that you pass clots, brittle nails and hair, depression, a slow heartbeat or bradycardia, and the thinning of the outer third of the eyebrows. That's a good telltale sign. And increased cholesterol. If you read the old textbooks on cholesterol, they will actually tell you the first thing to do is to look for a hypothyroid condition. Now we just give them Lipitor. It doesn't take care of the thyroid, though, and causes a lot of other problems. Also, hypoglycemia is related to the thyroid. We think of it as a blood sugar handling problem in the pancreas, but it's thyroid, adrenal, and pancreatic related. So we have to look at all those when treating hypoglycemia. And of course, that goiter. Here's a picture of the goiter in Hashimoto's disease. Here's a side view of the goiter. You can see it's a swollen thyroid, and it swells up to try to get more iodine into the thyroid to make those hormones. Then mixed edema, which is a swelling under the skin to give you this puffy look. It's accumulation of fluids. And in children, congenital hypothyroidism and cretinism, which is basically Down syndrome. So important to give a woman iodine when they're pregnant so that the child doesn't have Down syndrome. And they've also shown how iodine will increase the IQ level if the woman takes iodine during pregnancy. So my protocol for hypothyroidism, again, pick and choose what you feel you need, but potassium iodide and iodine. A good source of that is kelp or bladderwrack or any of your sea vegetables. Just be careful where you get that because of the radiation leak of Fukushima. The Pacific Ocean is now being contaminated with radiation. But I like to look to the poles, so Alaska, Nova Scotia, Newfoundland, or even the South Poles. The water tends to be much cleaner there. Vitamin A, D, C, and F are necessary for proper thyroid function, as well as selenium. Great source of selenium is Brazil nuts. Of course, you need the protein because of the tyrosine. And sometimes I'll use thyroid glandulars short term just to give that extra push I need. Remember to steam all your cruciferous vegetables, your cauliflower, broccoli, kale, Brussels sprouts. That will destroy the goitrogens that are blocking thyroid function. And actually, being a kitchen scientist, as I call myself, I've steamed bronchious vegetables and then taken the internal temperature. If it gets up to 160 degrees, it destroys those goitrogens, but so the outside of the vegetable is soft, but the inside's still a little crisp. And that's how you know that you're killing those goitrogens. Also, only eat fermented soy products. However, my thyroid patients, I basically tell them to stay away from soy. Let's move on to the iodine patch test. This one's fun to do, and this one's for iodine sufficiency, and it actually tests the iodine in the tissue. Again, I say do it in the evening, but you can do it any time. You just need to watch and see when the iodine has been absorbed into the skin. Is that before questions or with questions? Okay. Because this is 2 sessions, I'll stay between the 2 sessions and answer all your questions. I'd like to get through the thyroid before we move on. But you want to paint a 3-inch square. This basically is tincture of iodine. You can buy it in the pharmacy department of the grocery stores. You don't need a prescription. My mother used to put it on all of our cuts and scratches and scrapes when we were a child, and it burned the heck out of them. But you want to paint a 3-inch square either on your inner arm, your abdomen, or on your inner thigh. And let it dry because you don't want that staining your clothes. And you want to note the time that it was applied. And then I said upon rising first thing in the morning, look at this, but if you're home all day and can look at it, you can do it any time during the day. And you want to see what that color is. You also don't want to shower or bathe because it will wash the iodine off. So if it's still this bright orange, brown, yellow color in the morning, there's no iodine deficiency. If it turns a pale yellow, you'll have a mild iodine deficiency. If it's grayish color disappearing, you have a moderate iodine deficiency. If there's no color left at all, that's a severe iodine deficiency. And we're talking over 8 or 9 hours. If you remember when you were a child, if your mother used iodine, it took days to get that off. You had to scrub it off to get rid of it. However, I've worked with some clients who told me that it disappeared within an hour or two. And the reason why, the tissue is so starved of iodine, it's pulling it out of that patch. It needs it so much. So iodine and iodide, we think of it only for the thyroid, but every tissue in the body needs it. Dr. Jarvis was a medical doctor in the 1950s up in Vermont, and he wrote the book Folk Medicine. It's an excellent book. I would recommend you get it. You can still get it new, whether it be in a health food store or online. But what he says in his book, he says all the blood in the body passes through the thyroid every 17 minutes. When there's plenty of iodine in the thyroid, the germs that are in the blood are weakened by the iodine in the thyroid with each pass of blood and eventually killed if you're iodine sufficient. He recommended doing his toddy, which is the 2 teaspoons of raw honey and 2 teaspoons of apple cider vinegar in a glass of water every day or once a day or with meals. I have people do it if they have poor digestion. And he had them add a drop of Lugol solution to that, and he recommended it for fatigue. What you have to keep in mind, even if you live by the ocean, your soils should be high in iodine, but if there's any granite in that soil, it won't be. So if you live in Maine where they have those rocky cliffs, or the Northwest where they have those granite cliffs, or like in Colorado, I live in the goiter belt, so I see a lot of hypothyroidism because there's no iodine in our soil. I'm an avid gardener, so what I do to make sure our vegetables are high in iodine is that I will go ahead and add kelp to my soil. You can get it powdered, and I'll just put it in the soil and turn it in when I plant my plants, or you can get it in a liquid form and water it in like I do for my house plants, or you can actually spray it on the plant and it will absorb the iodine out of the kelp. So the properties of iodine are for production of thyroid hormones. It kills any bacteria, viruses, and funguses that might be in the body. It's anti-parasitic. It won't get rid of parasites, but if you have sufficient iodine, the parasites can't take hold. It helps you get rid of allergies. It's a mucolytic agent, which means it thins the mucus and the body fluids. So if you've got a lot of thick mucus and can't get rid of it, iodine will help break that up. We think of iodine as being stimulating, and I do tell my clients not to take their iodine before bed. I have them take it in the morning, but iodine is actually a calming agent. It will actually fight and help get rid of fibroids as well as cancer. In fact, Dr. Abraham and Brownstein are doing a lot of research on high doses of iodine to get rid of cancer. It can trigger apoptosis. Apoptosis is the normal life and death circle of a cell. If the cell dies properly, you're not going to get cancer. It's an alkalizing agent, so anyone who's too acid, the iodine will help with that. And it's also a detoxifier for chemicals or any other biological toxins in your environment. This is a mother with a thyroid goiter, and you can see her child is also affected. He has birth defects. Here's another young child with iodine deficiency. He's small. They get that squint. They have ataxia, which are these spastic movements, and they have mental deficiencies. They can also be deaf, and they can also be dwarf. And cretinism can be prevented if the mother has sufficient iodine before the onset of pregnancy. And I tell this to all my young clients. You have to heal whatever conditions you have, whether it's the male or the female, before you have children, so you're not passing on these genetic propensities. Food sources of iodine include, of course, the marine fish that come from the ocean. Again, I like those cold water fish such as cod, sea bass, haddock, perch, any of your shellfish. Seaweed and sea vegetables, they actually concentrate iodine from the seawater, but they have the same supporter system to get iodine into their cells as we do. So it's a very assimilable form of iodine. Fruits and vegetables can have it, but it depends on the iodine in your soil. If your soil is lacking in iodine, your vegetables will not. Cod liver oil has it in there because it will get into the liver and therefore into the oil. Eggs and dairy have it, but it depends on if they're eating grass that's high in iodine. But a lot of feed is fortified with iodine. The feed I give my chickens don't list iodine, so I break up kelp tablets. It completely changed the personality of my chickens. They're so friendly, and they talk back, and they're like pets. But I saw a big difference. Also, children that tend to have tantrums, I give them a kelp tablet, and it stops it within minutes. So, yes, and you might have to do it over and over again, but that's another sign of an iodine deficiency. And then, of course, there's iodized salt. I do not recommend that simply because of all the other chemicals that they put in it. I've done a lot of research on sea salt. It's not really a good source of iodine. However, the Himalayan sea salt has the most iodine of any of the sea salts, but I wouldn't really recommend it as an iodine supplement. Our Western diet barely contains enough iodine to keep us from getting goiters. The RDA for iodine to keep you from getting a goiter is 145 micrograms. Historically, that dose has been 1 to 6 milligrams, up to 9 milligrams a day, and the current therapeutic dose is 6 to 50 milligrams of iodine. Now, I've seen a lot of clients react negatively to iodine, especially those 50 milligram dose. So what I suggest they do, I start them off with a low dose, and I work them up to a dose of tolerance. And then while I have them on the iodine, I'm monitoring their thyroid periodically and their iodine through the basal temperature test and the iodine patch test. You need to be really discriminative in using iodine for thyroid autoimmune disease, whether it be Graves' or Hashimoto's. I've seen some people, it's gotten them over their iodine deficiencies, and then I've seen other people where it's exacerbated and made it worse, and now they have thyroid nodules. So be very careful about using it. The goitrogens, we've talked some about that. We're running out of time, but they're bamboo, cassava, anything in the brachia family, lima beans, sweet potatoes, your unfermented soy. Most people don't realize halogen molecules will get into those iodine uptake sites like bromide, fluoride, and chlorine. And your perchlorates, which comes from fireworks, jet fuel, and also those shows that rock stars put on. But they're being found in the soil now. It's terrible. Actually, you want to get rid of those goitogens because they actually bind to the iodine supporter systems and will create an iodine deficiency as well as destroying your thyroid gland. You just want to make sure you're not getting too much iodine. Some of those symptoms are acne, nausea, diarrhea, hair thinning, hyper or hypothyroidism, skin rashes, headaches, breast pain, and actually anyone with fibrocystic breast, they're saying now it's an iodine deficiency. It will break up those fibrocysts, those cysts in your breast. If you get a metallic taste in your mouth, excess saliva, runny nose, or those thyroid nodules. Now, the interesting thing about nutrition is that if you have too much or too little, you get the same symptoms. So that's why you have to keep all these nutrients in balance. But when you're full of iodine, you get a lifting of that brain fog. You feel warm even in cold climates. You've got lots of energy. You don't need as much sleep. Your bowel movements are regular. I want people to have 1 to 3 bowel movements a day. That's what we should have. It improves the complexion, and you can achieve so much more in less time. Okay, so since this is the end of the first session, during our break, I'll take any questions you'll have, and then we'll move on to the second session. In the second session, I'll be demonstrating the test on some people. So I'll be asking for volunteers from people in the room. Please only raise your hand if you feel you have that deficiency. That way it will save us some time.
Thank you so much, Donna. And we'll see you all here back at 3:15. Thank you so much. Give her a big hand.
And I just eat a diet, that's in normal foods. I don't supplement at all. And everything I've read, don't supplement with Hashimoto's. What do you think? And
As
you
I
you have to be
said,
careful.
some people get better and some don't. What I'm going to ask you to do, they're still recording this, so if you have questions, let's go to the microphone so that it could be on the recording, okay? Excuse me?
Where's your table for your book?
247. It's in the exhibit hall, and I'll be selling it after the seminar, okay? There's nobody there now. Okay. And what I was going to say is if you want my book, it will be there. I'll be there selling it after 4:30 when this is done. I'll also be at the book signing, the first one tomorrow, but not the second one. And you can also purchase my book tomorrow morning.
Okay, so Donna, we have the first
questions.
The first question.
I'm going to ask it on the.
Okay, can you wait
Mary
till they're
one.
done and I'll turn off my microphone?
I know.
Okay, thank you. Yes, the first question.
Okay, here's Mary. Okay.
Could you talk a little bit about mucin and what that means with thyroid, poor thyroid function?
Mucin?
Yes, I've read about it, but I don't really understand it.
I'm not familiar with it. What is it?
Well, I can't remember the author that I read it with, but it talks about how you can't take the skin in the top of your arms and, get a pinch of it because of the mucin in there.
Oh, that's
Am I saying that
probably
wrong?
that mixed edema. Remember how I said the body gets all those fluids inside and it gets all puffed up? So it's probably something that's going on with the mixed edema.
Okay.
I'm fine for now, but get me another glass, okay? Thank you. Yes?
I was just curious that Edgar Casey was selling an iodine supplement called
Excuse me, I can't hear you.
All right, Edgar Casey, their association, they sell Atomidine. It's a little droplet of iodine that you put in water.
A
Have you ever heard-
topical iodine?
It's you put a drop of it in a glass of water.
That's the Lugol solution, and you basically need a prescription to get it. You might be able to get it online on the internet, but drugstores carry it or could order it for you, but you have to have a prescription.
Well, I bought it online.
You got it
problem. But
online?
you think that's a good idea to supplement that iodine like that?
Yes, Lugol's is an excellent way to supplement with iodine. Again, you just put a drop or so in your water every day.
Thank you.
You're welcome.
Hi, thank you so much for all the wisdom you're sharing. My question is, you mentioned that cradle cap in babies is a sign of
Yes.
a yeast infection. I have 2 now, 5 and 3, that had bad cradle cap as babies. How can I treat a yeast infection in my child and help them?
Okay, those lacto-fermented foods, they're old enough to drink kefir or kombucha. You can give them some fermented foods with every meal. You can also get a probiotic, and for small children, you can get them from the pharmacy, and they're in packets. And you don't need a prescription, but you can just mix them in with their food, nothing too hot because you don't want to destroy them. Or you could just mix it in with some apple juice. That's the way I used to get probiotics into my children. Another thing to do, and you want to make sure you don't get it into their eyes. Do they still have dandruff or something going on?
Yeah, my 3-year-old still has it.
Okay, what I would recommend is get a cotton ball, soak it in vinegar, and make sure it doesn't drip. You don't want to get it into their eyes because it will burn, but the vinegar will kill the cradle cap or dandruff topically.
Wonderful. Thank you so much.
You're welcome.
My question is, you had referred to iodine as a previous method of sanitizing water as opposed to chlorine, drinking water. Now, is there a downside to that, or
you might taste the iodine if they put too much in it. You don't want to get too much iodine. Maybe that's why they took it out, because if you get too much iodine, we're going to send you into a hyperthyroid state. But yes, in the town that was right next to me, they used to purify their water with iodine, and just a year or two switched over to chlorine. And the residents are very upset that they did that. They preferred having the iodine in the soil. Excuse me, in their water.
because right now we have spring water at home. We're fortunate enough to have that, but the only kind of purification I do is I add a very small amount of colloidal silver, and it works excellently. But I am worried about the consistent, though it's a minute amount. It does give me
because that
concern.
colloidal silver will also destroy the bacteria in the gut as well.
Right, and we do supplement with probiotics, and but I realize that it's probably not.
Do you need to purify
ideal.
your spring water? Have you had it tested without purifying it?
Well, this is there's good reasons to, especially it's the stored water that I want to maintain, keep algae content down, so on and so forth. So
okay.
So yeah, it is necessary. I feel.
Mm-hmm.
Okay. Thank you.
You're welcome.
Hi. With Hashimoto's disease, would you chance supplementing with iodine? I know you said start low, but I do it through foods, and I'm afraid to supplement to try it, because could you do more damage even in the short term?
Oh, you might react. I've seen people with thyroid autoimmune disease react to the iodine. So can you do seaweed?
I do.
And you can eat sushi?
Oh, yeah.
Okay. Well,
occasion.
that means that you can do kelp.
Yeah,
Okay? So you can get a kelp tablet and get your iodine. The kelp also comes in powder forms. You can sprinkle it on your food.
Yeah, I actually eat kelp.
Okay.
I break it up and put it in my salads.
Every day?
Not every day.
Okay. Try doing it every day and see how you do. The thyroid also needs that vitamin F, that's essential fatty acids, so make sure you're getting plenty of that as well.
Yeah.
And your selenium, are you eating Brazil nuts every day and getting plenty of selenium?
No, occasional on Brazil nuts.
Okay, 3 Brazil nuts a day, and I recommend they not be soaked because we want those other things that are in there. So if you can, but people with digestive problems can't eat unsoaked nuts. So if you don't have digestive issues, eat them raw. If you do have digestive issues, then soak them, and you'll still get some of your selenium. But they say 3 Brazil nuts a day will give you your body's daily allowance for selenium.
What would be the symptom most, that I would observe most if I had the iodine too much?
You'll feel hyper, irritable, heart palpitations.
That's me anyhow.
Those types of things. And then you can palpate the thyroid to see if you get nodules. Those are the symptoms that I've seen people get.
And of course, testing.
Okay.
Thanks so much.
You're welcome. Thanks for being here.
I've been seeing an integrative medical doctor.
I can't hear you.
I've just been diagnosed with Lyme's adrenal fatigue and thyroid. I think hypothyroid. And we've been working on my condition for 2 years now. We're now working on the thyroid, and he has said that I should not be taking iodine.
Why?
I'm from Wisconsin. I don't know if that makes a difference. He suggested they can do something different with the thyroid, and I don't have my notes with me because I don't quite understand it all yet. But I'm just wondering, where would that...
I would think the iodine would help combat the Lyme's disease simply because it's killing every infection that's in the blood every time it passes through the thyroid every 17 minutes. And I do have a lot of my Lyme's disease clients on thyroid supplements, and nutrients to support the thyroid, because a lot of them do have hypothyroid condition with Lyme's. So unless I see the research that you can email to me that says why not to do it, I give my Lyme's clients iodine.
Thank you.
So again, try eating kelp or seaweed or taking a kelp tablet and see how you do.
Okay, thank you.
You're welcome.
Hi. Do you recommend elimination diets? And if so, do you see that it's possible for them to cause further food sensitivity?
Which diet?
Elimination diets to identify food sensitivity?
Yes, but they take a long time. You basically have to eliminate all those foods for 30 days and then reintroduce them one at a time. So yes, I do food elimination diets, but I found the COCA pulse tests can do it in a shorter amount of time. Okay. And that's why I recommend that test.
Okay, and one quick follow-up question. If you do an elimination diet, do you think that it can cause more food sensitivities for people, or are those existing sensitivities that are just coming up through doing the elimination diet?
I've never seen get more food sensitivities from an elimination diet. It's just sometimes if you add it back in and you haven't repaired the gut lining or gotten rid of the yeast or candida that might still be there, you'll get that food allergy again. So you need to do the healing before you reintroduce the foods in your diet. And we'll talk more about that, because usually once you heal that gut lining, you can then eat the foods that you're allergic to 1 to 3 times a week. And I tell my clients to take a digestive enzyme, and they could usually get away with it just doing it infrequently. They can eat those foods. Excellent. Because it's hard to eat out and not eat gluten. It's everywhere.
Okay, thank you.
You're welcome.
Do you have any concerns about mercury or toxic metals in kelp?
That's why I said to get it from the poles, because you don't want to get it from where there might be some industry that's putting mercury into the water. So try to get it from Alaska, Nova Scotia, New Zealand, or down by Peru or Argentina in South America.
You did say that, sorry.
But yes, mercury can interfere with thyroid function. So you need to be careful about that, because the mercury can bind into some of those uptake sites as well. Good question. Anybody else? Thank you.
Oh, just thought I'd mention that I know that Biotics carries a liquid iodine supplement that you can order through an NTP or a certified. You don't have to have a prescription, so I just thought I'd mention that.
Okay, that's good to know.
Yeah,
so
Biotics
if you work with a health professional, Biotics is a professional nutrient line that's only available to health professionals, and they can get you that liquid iodine from them so that you don't need a prescription. Thank you for telling me, because then I can get it as well.
And I just thought I'd also mention that love to see that you're going to do the Ragland's test, because all of us that are NTPs through the Nutritional Therapy Association are required to learn this test.
Oh, great. That's going to be what we talk about at the start of the next session. In fact, I will be asking for someone to come up so that I can demonstrate how to do the test. It will be hard for me to hear with the stethoscope in this, but I can still, so I can't do an accurate reading. However, I can demonstrate how the test is done. Yes?
Hi. You mentioned the current therapeutic dose for iodine is 5 to 50 milligrams per day.
Excuse me?
Sorry. You said that the current therapeutic dose for iodine is 5 to 50 milligrams per day. How did that translate to the Lugol 2% drops? Do you know?
You'll have to look on the bottle and see how many milligrams of iodide are in that 1 drop of Lugol solution that you're using.
Okay, because I know there's 2% and there's 5% out there.
Okay, where did you get your Lugol solution?
I got it online.
Can you go online and ask them the iodine content in both of those solutions so you know how much you're taking?
Okay. Thank you.
Yes, that's what I would recommend. I would say go to the source of where you got it. They will have that information.
Thank you so much, Donna. We're going to get started now with the second part. I want everybody to come in and please sit down and let's close those doors, darling, Kirsten. And make sure you tell your friend not to slam the door. We're recording this. Okay, so we have Donna Wild.
Excuse me, I volunteered
Donna, be careful with your mic.
First new test. I'd appreciate it.
Which test?
What? Thyroid. And the other.
Okay. What I'll say is come by to my booth in the morning and you could use my thermometer to do the temperature test, okay?
I had thyroid surgery years ago and I've been on
Okay, so
many years. And I just felt like
we have Donna Wild, non-invasive testing for nutritional deficiencies, part 2.
What time?
I should be there about 9 o'clock, okay?
Donna, don't put your hand on that. Thank you. Okay, thank you so much. Here's Donna. Let's give her a big hand.
Thank you all. For those that weren't in the previous section, for some of the tests that I'll be demonstrating today, I'm going to ask for individuals from the room to come up so that I can show how to do the test. If you feel you have that deficiency, please come up because it will give us a better understanding. So we're going to start this part of the session with Ragland's test for hypoadrenia function. That's what he called it when he wrote the paper in the 1920s. We now call it adrenal insufficiency. This is an easy to perform test. However, you do need a blood pressure cuff and a stethoscope to do it. So if you don't know how to take blood pressure or have the equipment, I'd say ask a nurse or a doctor that does have it. So Dr. Ragland was a medical doctor, and in the 1920s he wrote a prize-winning paper, and by the way, I put the paper on my website with all the handouts for today's session, so you can read the paper yourself if you like. Let me just pull this out so I have it ready. Okay. So this technique measures the adrenal's ability to compensate for the hydrostatic effects of gravity. Hydrostatic is keeping the fluids in the body in homeostasis. In this part, we're looking at the blood. But he said this test could indicate adrenal insufficiency, cardiovascular sufficiency, and aesthetic syndrome. Aesthetic syndrome is like chronic fatigue, weakness, dizziness, that trembling that people get. That's what's meant by aesthetic syndrome. The theory behind this technique is when the body is lying down in a horizontal position, you don't need gravity. There's no effects of gravity, so there's less pressure needed to keep the blood flowing to the brain. And it results in a slight decrease in your blood pressure. When an individual stands or sits up quickly from a seated or lying position, the blood pressure needs to increase slightly to counter the effects of gravity and get the blood flowing to the brain so you don't get dizzy and lightheaded. The nerves of the splenic veins, which are the veins going to all the visceral or vital organs of your body, the brain being one, constrict to compensate for this effect of gravity. These splenic veins don't have valves in them, so the veins have to constrict to get the blood going up to the brain. The nerves in the splenic veins that causes that constriction is under the ruling of the adrenal glands. So if the splenic nerve tone is weak, the splenic veins do not constrict properly, and therefore it's a reflection that the adrenals are weak because the adrenals are not doing their job. So do I have somebody from the audience that would like to come up? Wow, I've got a lot of them. Now let me tell you, I'll be at my booth tomorrow morning, and again, it's kind of hard to hear there, so that's a hard one to do, but come on up. Did you want to come up as well, since you have to do the test? Did you want to come up as well? Yes, since you have to learn this test? Okay. Oh, okay, then we don't need to perform it on you. Sorry. I thought you said you needed to learn it. Okay. I need you lying down. I need to get to your forearm. I had to learn to do blood pressure as a nutrition major. Okay, so you want to put the cuff around the upper arm. We need to pump up the cuff. Excuse me, I need to get the stethoscope under the cuff, right at the elbow, or right above the elbow, and then I'm going to pump up the cuff, and I'll do it so that it gets above 130 or so. There we go. And then release it slowly. And listen till you hear the first click or change in the blood pressure. So you let the pressure out slowly. Listen for the change. Have them sit up very quickly or stand. And then I keep the cuffs pumped up slightly. Pump it up again. And then take the reading again. Oh, there it was. So that one was about 110. Okay, and I didn't get it while lying down because I was talking. But that's how to perform this test. So you really just need to know how to take a blood pressure. So you need to record both readings. And you only want to take the systolic. You don't have to do the diastolic. So the systolic is the upper number of the blood pressure, which reflects the function of the heart. The lower number, or the diastolic reading, actually reflects what's going on in the kidneys and the other fluids in the body. The systolic, which is the upper reading, not the diastolic, which is the lower reading. We're only going off of the systolic. So in a patient that has healthy adrenal gland function, the systolic blood pressure should rise 4 to 10 millimeters of pressure in the standing position over the lying position. If the blood pressure goes down with that systolic reading when they stand, that means that they could have hypoadrenia or adrenal insufficiency because the adrenals are not putting out the messages to constrict those veins to send the blood to the brain. So let's talk about the adrenal glands. I see a lot of adrenal insufficiency in my practice today. I think we're all under stress, whether it be physical, emotional, psychological. We deal with a lot of stress in our lives these days. It's amazing. All that's technology was supposed to make us work less hours, And what I find is people actually work more hours today than they did back in the 1940s and 50s. The adrenals are these fatty balls that sit on top of the kidneys. So ad means over, renal means the kidneys, therefore adrenal or it's over the kidneys. They're no bigger than a walnut and they weigh less than a grape. They basically control the autonomic nervous system, which is again your fight or flight, which is your sympathetic dominance, which you go into when you're under stress. And they should send you back into parasympathetic dominance when the stress is done, but today a lot of people just stay in sympathetic dominance. But the adrenals enables the body to deal with and endure physical, emotional stress, any challenges or deprivation. They're also the richest source of vitamin C in the food chain, more than vegetables. In fact, if anybody here read Weston Price's book, Nutrition and Physical Degeneration, well, he talks about Dr. Price going into the northern Canadian territory and talking with the indigenous American Indian tribes up there. And he was very surprised that they lived in a climate where in the wintertime it can get 60 below zero, so they don't eat a lot of fresh fruits and vegetables. And none of these tribe members had scurvy. Scurvy is a disease of a vitamin C deficiency. So he asked the tribe, the doctor of the tribe, he says, "This is very interesting. I don't see anybody eating fruits and berries and vegetables, but I see absolutely no scurvy. How do you prevent it?" So he had to get permission from the tribe leader to tell this white man what they do, but the doctor took him aside, the healer of the tribe took him aside, and he actually showed them that when they catch moose to eat for meat, they make slits in the back, right at the kidneys, and they remove that fatty adrenal gland and they slice it up into portions for every single person in the tribe, and everybody in the tribe eats a raw piece of adrenal gland to keep them from getting scurvy. And basically the adrenals regulate vitamin C metabolism in the body as well. So one thing with adrenal insufficiency is to give people plenty of vitamin C. And we'll get into my adrenal protocol. But we talked about the adrenals needed to respond to stress. It's also necessary to reduce swelling and any inflammation in the body. It helps with the sodium-potassium regulation in the body. It's needed for blood sugar regulation. Remember I said it's thyroid, adrenal, and pancreas. It's needed to convert fat and proteins into energy. And it's for the distribution of stored fat. And one way to tell if you're adrenal efficient is the sides of the cheek starts to puff up and get fatty. And then if you get that spare tire around the center, that's the other place that people with adrenal insufficiency will put on fat. It's necessary for proper heart function. It maintains your daily energy flow. It's for muscle strength and stamina. And it also manufactures, secretes, and regulates steroidal hormones in the body, whether it's cortisol, estrogen, progesterone, or testosterone. In fact, after menopause and andropause, the adrenals become the main source of producing your sex hormones, since the ovaries and the testes shut down that production. And the way that they do it, you know, when people become menopausal or andropausal, they tend to put a little fat on around the center. The aromatase enzyme takes that fat and converts it into your sex hormones with the help of the adrenal glands. If you have adrenal insufficiency, you'll find that you have weakness, Dizziness, especially when getting up quickly. So if you stoop down and get up and you get dizzy, that's a sign of adrenal insufficiency. Low grade or chronic fatigue, or the inability to handle any type of stress, whether it be physical or mental stress. If you have low levels of adrenal cortisol, you'll be a slow starter in the morning. Those people that have a hard time getting out of bed and getting going, that's a major sign of adrenal insufficiency and low cortisol. Hypoglycemia is another one, muscle aches and pains, craving for salt or sugar. In fact, in Hauer's book of endocrinology, he says people with weak adrenals, their adrenals can actually live off of salt. So when any of my clients tell me they crave salt, I always look for adrenal insufficiency. These people tend to be moody. When they exercise, they get completely exhausted and they can't exercise for long periods of time. And again, if they're on any type of thyroid support, they'll get poor response to their thyroid support because remember, you have to support the adrenals in long-term thyroid conditions as well. Some of the things that will stress out the adrenal glands are stress, whether they be worry, whether they be relationship issues, work, financial problems, and even pollution, air pollution, and especially the electromagnetic waves that are in our environment. They really affect the adrenal glands. Lack of sleep will also affect the adrenals. Prolonged fasting or starvation because they cause vitamins, minerals, and protein deficiencies. Any type of infections or chronic diseases or illnesses. And they say the more chronic and longer the disease, the more the adrenals are weakened by it. Autoimmune disease. We talked earlier about allergies and food sensitivities and how they affect the adrenal glands. Violent injuries or any type of trauma can also cause the adrenals to become insufficient. Temperature changes, extreme temperature changes can do that as well. Overindulgent in alcohol or drugs, even pharmaceutical drugs. Extreme exercise will weaken the adrenals. And this is how you get exercise-induced asthma, because the adrenals also overrule the lung function, and when people exercise a lot or go running, they get into an asthma attack, I always look to the adrenals to help that. In fact, in any type of asthma, I give them adrenal support. Low thyroid function, again, that relationship between the adrenals and the thyroid. Even psychic shock, hearing of a friend or a family member that died or got into an accident or something horrible happened to them will affect your adrenals. Acute acidosis, when the body gets too acid, it affects the adrenals. In fact, being under stress will cause acidosis in the body as well. And also any severe hemorrhaging, that blood loss will really affect the adrenal glands. So let's talk about what's needed to heal these adrenals. The adrenals need a lot of vitamin C. Remember, they regulate the vitamin C production in the body or utilization in the body. So you need to eat a lot of fresh fruits and vegetables so that you're getting your vitamin C. Also, they need vitamin G. Vitamin G was actually named after Dr. Goldberg, who was commissioned by the Army in the 1920s to go into the South and figure out why they had pellagra and how to cure it. Pellagra basically means rough skin in Italian. So they would get all these skin conditions and rashes. They would have digestive problems. So people with ulcers and digestive problems are lacking in this G factor of B vitamins. And they also get mental diseases. So they would find it in orphanages and in prisons in the South. But then they were also feeding them on cornbread and salt pork. And Dr. Goldberg found that when he went in and gave them raw milk and real meat, and he was giving them these G factors, which are B vitamins and amino acids, that they would get over their pellagra in 6 to 9 months just by changing their diet. And I have a slide that shows the difference between the B and the G complexes, and I'll bring that up in a moment. But the adrenals also need copper. Copper is part of the enzyme that activates adrenal function. So you need a lot of copper. You need potassium. Potassium, magnesium, calcium, iodine, they're all nerve-relaxing trace minerals. When people are in sympathetic dominance, I give them some B complex and potassium to get them out of that sympathetic dominance. If they have tachycardia, I make them chew it to stop the tachycardia. You can also use adrenal glandulars. I tend to use whole desiccated adrenal only short time. You give anybody a desiccated product for a gland. The gland doesn't think it needs to make anything because it has hormones in it, and long term it will shut down the adrenal gland. I do use it 3 to 6 months just to jumpstart the adrenals while I'm building them up, though. Licorice root is an excellent adrenal support product. It's an adrenal adaptogen, but you can't use it if you have high blood pressure or any type of edema. You could use Korean ginseng. It's a little more stimulating. I find it too stimulating for myself, but it works well for a lot of clients, especially men. I like using eleuthero. Eleuthero is Siberian ginseng, and it works excellent for women, especially those that have a lot of sleep problems associated with the adrenal glands. Romania and ashwagandha, it's also called withania, they're another adrenal adaptogen. You could use adaptogen and tonics from herbs long term. Otherwise, I only use herbs short term in people. But things that are tonics or adaptogens, you could use those for very long periods of time. And again, I give them sea salt because remember, Dr. Harrower says adrenals can live off of salt. But I find a lot of their symptoms go away if they just add a little bit of sea salt to their water. So what I recommend is a teaspoon of sea salt to a gallon of water. And if they're doing water bottles, we just break it down. Okay, this is a pint. There's 4 pints. Well, there's 4 quarts in a gallon. So it's about 1/8 of a teaspoon into a pint of water is what you need. If you can taste the salt and you don't like it, reduce the salt a little. Some people just don't even taste it at that solution, though. But here's the diagram of the B complex. So the B factors tend to be thiamine or B1, vitamin B4, which you can hardly find any information about these days. It's an anti-paralysis B vitamin. Vitamin B12 or cobalamin, and pantothenic acid or vitamin B5. These B factors are nerve innervating, vasoconstricting. So, of course, if you have the hypoadrenia and you need to constrict those blood vessels, that will work well as the G that it needs. But I tend to use those B vitamins on anybody that has low blood pressure or cardiac insufficiency. Where the G complex is nerve relaxing, nerve regenerating, vasodilating, and I tend to use those on people who have high blood pressure because by dilating the blood vessels, the blood pressure will go down. I also use the G vitamins for any type of neuropathy, as well as I said tachycardia and panic attacks. It's great for that. But the G complex is made up of riboflavin or vitamin B2, niacinamide or B6, niacinamide or B3, should put my glasses on, pyridoxine or B6, biotin, which is B7, choline and inositol, which is great for the liver and the brain, and also folate or B9. And then we have these other B factors that I have not found information what categories they fit into. And found in nature, manganese is the biochemical activator of the B vitamin complex. And if you get B vitamins from food, the manganese will always be there. And that's what's great about doing food-based supplements or using food to heal. I know they have all those other cofactors that the body needs to assimilate nutrients. Basically, in nature, wherever there's vitamin C, there's also A and E in it, and you're going to find some copper as well. And you don't always get those in your supplements. So make sure you're doing whole food supplements or eating good, wholesome foods. Okay, the next test we'll be going over is the calcium cuff test to assess whether you have enough calcium going into your tissue. This is the only test I know that tests for tissue calcium starvation. This came from European naturopaths that use this test. Does anybody get muscle cramping or Charlie horses? Okay, come on up. Can you roll up your pants? In this test, you need a blood pressure cuff, but you don't need a stethoscope, and you don't have to know how to take a blood pressure. And for people that have big calf muscles, you can buy a larger cuff. So you want to put it around the gastrocnemic muscle or the calf muscle. And again, clamp it on. Close it up and pump it up. And what I want you to tell me is when you feel pain or cramping. And that's when you take the reading and stop. Okay, so hers is hurting at 180 millimeters of mercury. Okay. No, it needs to be at least 200. Okay, so that's basically, it's a real simple test that you could perform at home if you know someone that has a blood pressure cuff, or it's called a sphygmometer is the professional term for it. But to get optimal tissue calcium status, you want to have a 240 millimeter read. I take 200. That's what I find I can get most of my clients to. That means you have adequate tissue calcium status. Or if the cramping or pain below 200 milligrams, like it did with the lady that was just up here, hers was 180, that means you have poor tissue calcium status. So then I'll recommend them doing foods that are either high in calcium, or I'll put them on a supplemental calcium. And what I would do normally, if I had the time, I would have you chew some calcium and then retake it again in 5 minutes. Because the calcium, once you chew it, you get that sublingual absorption. And I see if the calcium changes the reading. If the calcium doesn't change the reading, then I'm going to look to maybe a deficiency in some of the synergists. Vitamin D is one of them. Vitamin D takes calcium from the stomach and drives it into the blood. Vitamin F, which is an array of essential fatty acids, and vitamin K2, that's found in fermented foods, they take those minerals such as calcium, magnesium, potassium from the blood and drives them into the tissue where we need them to be to stop this muscle cramping in Charlie horses. Another reason why you might have poor tissue calcium is magnesium. Magnesium and calcium need to be in balance. In fact, if you have too much magnesium, it's going to make your calcium go down. So again, you need to keep all these minerals in balance in the body. And I'll bring up a chart later that shows it, and it's also in the back of my book. You may be lacking in hydrochloric acid or not enough acid in your stomach because calcium gets absorbed through the stomach but only in an acid environment. So if you have hypochlorhydria, you're not going to be assimilating your calcium. Otherwise, what I do is I give them the calcium supplements and have them come back in 6 weeks and test it and see if the mercury rises. But tissue calcium is different than bone calcium. Tissue calcium is needed for muscle contractions. It's needed for nerve transmission to get those nerves jumping between the synapses. It's needed to coagulate the blood, and it's also needed for the immune system. When the body is under attack, it sends out phagocytes to kill those germs, but it's got to get that germ into its cell to be able to eat it up and spit it out, or dissolve the infection, or kill the infection. And to do that, it has these arms that come out and engulf that germ or virus or infection, bacteria, and it brings it into the cell so it can get rid of it. That arm that comes out are made up of calcium. If you don't have enough calcium, you can't fight off an infection. So a lot of times I give calcium. I always give calcium to people that are under an acute infection, especially have a fever. In fact, fevers in small children is usually due to a calcium deficiency. However, calcium bicarbonate is the biologically active form for tissue calcium in the body. The only place this is found is in spring water. So if you're drinking bottled water, don't drink the purified water. Get the spring water, or you're getting it from your well. So you're getting plenty of that calcium bicarbonate. However, it's the only place it's found in nature is that spring water. So if I'm going to supplement them, I'll do it with a calcium lactate. Calcium lactate takes one biological step to be converted into calcium bicarbonate. Or I'll use calcium citrate. Calcium citrate is not found anywhere in nature, but it's easily made and you can get it in a supplement form. You can make your own calcium citrate. All you do is you take a raw eggshell, take the white membrane off, pour lemon juice in it, and it will dissolve that eggshell. And you can take that as a calcium supplement also. There's also calcium carbonate. This is your rock and your seashell calcium. This is very hard for the body to assimilate, and people taking this usually ends up with kidney stones, bone spurring, spondylitis of the spine, which is calcification along the spine, simply because it cannot get into the tissue and it just forms these deposits. Calcium carbonate takes 11 to 12 steps to be converted into that biological form of calcium bicarbonate. And it needs an awful lot of hydrochloric acid to be assimilated in the body. So anybody that has poor stomach acid is not going to be able to take that. Some signs of low tissue calcium are muscle cramping in Charlie horses, muscle aches and pain, itchy skin, sunburn, windburn, any type of herpes or shingle outbreaks. It's true. Spell checker didn't pick that one up. Thank you. It's amazing how many times I went over this presentation and didn't find that, but I will change it. Thank you. So this happens a lot in Colorado when people do a lot of mountain climbing or skiing, especially skiing. Our atmosphere is so thin, we get more ultraviolet rays. People are out there, they get a lot of sunshine. The sun is full of, the sun works with the cholesterol that's in the skin to make vitamin D. So being out in the sunshine, it takes the calcium out of the tissue and drives it into the blood, which is what vitamin D is supposed to do. But then it leaves the skin open to getting these herpes eruptions, which is so very common. So what I do is I give them calcium and some K2 to drive that calcium into the tissue, before they're out playing in the sunshine, especially in the snow because you get that reflective sun as well. And we also need calcium for our immune system. Remember I talked about the phagocytosis and the need for the calcium to make those arms. So rich food sources of calcium include milk, yogurt, cheese, sour cream, kefir, any type of dairy product. Raw dairy is best because when they pasteurize dairy, they heat it up and it cooks that calcium and it's not as assimilable as the calcium in raw milk. Your leafy green vegetables are an excellent source of calcium. Spinach, collard greens, Swiss chard, kale, romaine or leafy lettuce, and also broccoli is a very good source. Barley water is another way of doing it. It's a great way to get it into children. You take a cup of barley, you put it in a quart jar of water, stick it in the refrigerator overnight, and you can drink the liquid, and you'll get calcium from that. Basil's a good one, sesame seeds, as well as cinnamon. Cinnamon is also great for help regulating blood sugar levels. Here's the mineral relationship chart I was talking about. So when people are deficient in a mineral, I look to see if they're getting too much of another mineral, causing things to be out of balance. So you could see with calcium, if you have too much, it will decrease the magnesium and manganese in the body, but it works just the opposite way. If you have too much magnesium or manganese, it's going to depress the calcium. Also, if you have too much phosphorus in the body, it can deplete the calcium in the body because the blood always wants to stay stable. So we need to make sure, if we think we have a deficiency, that we're not going to take too much that causes another deficiency. Everything needs to be in balance, and the beauty of eating foods or doing whole food supplements, you're less likely to get out of balance. Okay, let's move on to the zinc taste test, or it's also called the zinc tally test. Does anybody here feel they have a zinc deficiency? White spots? Okay, come on up. I'll take a few people for this test. Anybody else? Okay, come on up. Come on up. Yes. And sit down. Okay, you can sit down because I'm going to talk a little bit about the test before we actually do the test. So this is based on the taste bud sensitivity to the taste of zinc. Gustin is a zinc-dependent polypeptide which is necessary for normal development of the taste buds. So if you have plenty of zinc, you have plenty of this gustin, and you'll be able to taste the zinc and get a strong immediate reaction. You can make this zinc taste test solution at home. You mix 2 grams of zinc sulfite into 2 liters of distilled water, or you can buy it from different companies. I tend just to buy it, it's easier. For best results, you don't want to eat, drink, or smoke anything for at least an hour before doing this test. You can also use this liquid as a zinc supplement. I don't do it because when I swallow it, it gives me a headache. I tend to use zinc more from foods and glandulars as a supplement. Also, if you have a mouth full of amalgam fillings, you might get a false test when you do this because the zinc is going to affect the metal in the mouth and you'll get a metallic taste. Okay, so I'm going to give you the liquid, and I want you to hold it in your mouth for 10 seconds, and then you can either spit it back into the cup or you can swallow it. Okay? And you see, it's a clear liquid. Are we counting? 9, 8, 7, 6, 5, 4, 3, 2, 1. Okay, spit it out or swallow it. Okay, what reaction did you get? You tasted it, didn't you? Was it immediate or was it a little delayed? Okay, how was yours? It didn't taste bad. Was it sweet? Did it have any flavor? It was a bit of an aftertaste. Okay, and yours? Bit of an after. Okay, do you have amalgam fillings? Okay, then it's probably just the taste of the zinc, because zinc is a metal, okay? So, the response is there's no taste at all. It tastes just like water. That's a severe zinc deficiency, and I'm going to supplement them with zinc as well as have them eat foods high in zinc. If you get a slight taste or a delayed taste like you two ladies got, that can indicate just a zinc deficiency, not a severe one, and I would probably put you on a zinc supplement or just tell you to eat foods that are high in zinc. If you get a mild, unpleasant taste, that's a mild deficiency, sort of like what you got. But if you get that strong, immediate taste, and it probably tastes terrible, then you have an adequate zinc status. So as soon as you put that in your mouth, you should basically get this strong, terrible taste in your mouth. And that means that you have adequate zinc status. So thank you, ladies, for coming up and helping me demonstrate that. Yes? Then what I'm going to do is have them eat foods high in zinc or give them a zinc food-based supplement. And I'll have them come back 3 to 4 weeks later and test again. If I test them again in 3 to 4 weeks and they still have a poor test results, then I'm going to look for hypochlorhydria or low hydrochloric acid in the stomach, because zinc needs hydrochloric acid to be absorbed and assimilated in the body. Some facts on zinc. Zinc has a catalytic, structural, and regulatory role in many of the enzymes of the system. It's needed for gene transcription. It's needed at all hormone receptor sites. And it's needed for signal transduction pathways that are essential for human metabolism, growth, and reproduction. Zinc is necessary for healthy nails, skin, and hair. Those white spots on the fingernails are a telltale sign of a zinc deficiency. Also, if you're eating too much sugar or refined carbohydrates, you might get those white spots, because the pancreas needs zinc, chromium, and B vitamins to produce insulin. If you're eating a lot of sugar, you're not producing good insulin, so we'll give you some of those supplements to help you. It's needed for taste, sensitivity, and appetite regulation. In fact, when people tell me they lose their taste of sense or smell, I always put them on that G complex, that nerve regenerating B vitamins, as well as zinc, and I could usually get their taste back. It might take 6 to 9 months of doing it, but we get their taste and smell back. I also give it to people who have anorexia and bulimia because it helps with appetite regulation. B6 is also good for that. Fertility, especially in males, but also in females. It improves memory and attention span. In fact, they did tests and they gave zinc supplements to middle school children before school, and they found it raised their test scores and kept them focusing in class. It's needed for blood sugar control, weight control, and diabetes. It's needed for the production of neurotransmitters, especially GABA and serotonin. And it strengthens the immune system, and combine it with vitamin C, you'll get even better results. Zinc deficiencies are associated with anemia. There's many different types of anemia in the body or in the blood system of the body. Short stature, so children who aren't growing, especially during puberty or childhood, we give them zinc to help with growth. Hypogonadism in men. Impaired wound healing, so if your wounds just won't heal, look to a zinc deficiency. As well as geophagia. Geophagia is when people eat dirt. They like eating dirt. There's usually a mineral deficiency. It could be iron or it could be zinc. The thing about zinc is it's not stored in the body. And it can be depleted, like I said, by sugar consumption, exercise, sweating, chronic infections, and stress. So you should always be eating foods high in zinc every day to have adequate zinc status. Some of the other signs of zinc deficiencies, I showed you the white spots, but also hyperpigmentation, dark blotches on the skin. Also, this weeping, pustules and ulcers that weep, especially on the lower extremities, is called erythematosus, is the technical name, but that's a zinc deficiency. Also, that dark skin with a flakiness to it, that's a zinc deficiency coupled with fat malabsorption. So I'll give them something to get the bile flowing, either give them bile or give them betaine, and the best food source of betaine are the beet tops. The beet leaves are a very good source of that. The RDA for zinc is 15 milligrams. Therapeutic dose, I usually start at 30 milligrams to get them up to a zinc status. Other signs of zinc deficiencies include acne. A lot of acne is either zinc or iodine deficiency, but it could also be caused by an infection or hormonal imbalances. Skin rashes, we talked about loss of sense of taste and smell. Hair loss could be a zinc deficiency. Stunted growth, late puberty, whether it's in males or females, poor concentration and learning difficulties, a low sperm count, infertility in both men and women. Sometimes giving them zinc is the secret pill to help these young couples get pregnant. And also a weakened immune system is a sign. So constant colds or flus. It's okay to get a cold or flu once or twice a year. If you're getting them more than that, you have a depleted immune system. So some rich food sources of zinc is good red meat, and hopefully it's grass or pasture fed. Shellfish is an excellent source, especially oysters. Even the smoke oysters that you get in the can will be high in zinc. If you like them raw, go ahead and eat them that way. Shrimp and crab are two other shellfish that are very high in zinc. Eggs, pumpkin seeds is a great vegetarian source of zinc and something that you can carry around with you and snack on. Other types of nuts and beans or legumes. Blackstrap molasses. I want to take a moment to talk about blackstrap molasses. I use it in my clients a lot as a mineral supplement. It's very high in iron, magnesium, zinc, so many minerals as well as some B vitamins. Now, I'm not going to give it to you if you have candida or a yeast infection because it's going to feed that yeast infection. And you have to be real careful about how much you use because if you take too much of it, it's going to cause loose stools or diarrhea. So I usually have my clients start out with 1 to 2 tablespoons a day. In fact, for premature graying, giving molasses might bring the color back to the hair. Only if it's premature graying, though, because it's coming through the liver, and the liver needs a lot of trace minerals. Your hair color, the liver helps control that. So you need your trace minerals to feed your liver. The liver also needs a lot of healthy fats and fat-soluble vitamins, as well as, there was one other the G complex of the B vitamins is what the liver needs. In fact, you can get your G vitamins just by eating the raw or desiccated liver. Brewer's yeast or nutritional yeast. I use this as a supplement, especially for a lot of my vegetarian clients because it has the protein and all the minerals and the B vitamins, especially the B12 they're not getting in their diet. Rice bran and wheat germ are also a very good source of zinc. So let's move on to stomach acid. How are we doing on time? Oh, great. I've been talking so fast. We've got lots of time for questions, and I can slow down. Okay. Let's talk about hypochlorhydria then. Hypochlorhydria is not enough hydrochloric acid in the stomach. If you don't have enough hydrochloric acid, you're going to get symptoms of bloating, belching, burning feeling after a meal, feeling too full, finding food still in your stomach hours after eating, so you're all bloated and you still have that full feeling 2 to 3 hours after a meal. By that time, the food should be out of the stomach and into the small intestines. Thinning of the fingernails, poor hair quality and hair that falls out, broken capillaries, whether it's on the face or anywhere on the body, foul smelling flatulence. So if you have these horrible smelling farts, that's an indication of low stomach acid. But in dogs and animals, it's usually a yeast infection too, so you have to rule that out. In fact, for dogs that have smelly gas, I give them a probiotic, and that stops it. So look to low hydrochloric acid and a probiotic for those foul-smelling farts. But especially after eating a high-protein meal and you get those foul-smelling flatulence, that is a hydrochloric acid insufficiency. And then also, if you find particles of undigested food in your stools, that means you're low in hydrochloric acid. So this is an easy test to do. You could do it at home. All you need is some apple cider vinegar, or if you have a betaine hydrochloric acid supplement, you could use that as well. But most cases of indigestion are caused by low stomach acid. Taking vinegar or a hydrochloric acid supplement with enzymes should bring prompt relief if that's what the cause is for. So you want to take 2 teaspoons of apple cider vinegar, and you can drink it straight up or mix it with a little bit of water. Or if you don't like the taste of apple cider vinegar, a lot of my clients refuse to take it. They would rather take a pill. So I give them 1 to 2 tablets of betaine hydrochloride. A betaine hydrochloride basically just takes water that's in your stomach to be converted into hydrochloric acid. So it's a safe way of taking a supplement without getting that burning that you'll get from hydrochloric acid. And you want to do this while there's indigestion, so while there's food in the stomach causing all these symptoms. Then you want to wait 20 to 30 minutes and tell me if you feel better or worse. If you feel better, it's an indication of low stomach acid. If you get a burning or tingling sensation that occurs when you do this, you probably have some gastritis or a stomach ulcer going on. If the individual feels the same or slightly better, I'm going to up the amount of the apple cider vinegar or the betaine hydrochloride that I'm giving them and wait to see what that response is. And then you want to dose at the number of tablets or the amount of vinegar you take that gives you the best positive response. And you want to do that at every meal. Now, what some people don't understand is GERD, you know, that acid reflux. That can be low stomach acid. So they give you acid blockers to stop it, but what's going on is you don't have enough hydrochloric acid in your stomach, so the proteins putrefy, the fats go rancid, and they cause these acids of putrefaction, and that's what's causing all the burning of the stomach and the esophagus. So that's why the first thing I do when a client tells me that they have GERD or acid reflux, I have them do this test to make sure it's not the acids of putrefaction, it could be the low stomach acid. Another thing I found with my GERDS patients is it's usually a food allergy that's causing it. And when we eliminate the food, their GERD goes away. So if you were here earlier, or you can go on my website and get the handouts on how to do the Coccus Pulse test for food allergies. But a lot of people are taking antacids when they get an acid reflux, or they're taking these acid blockers, and people don't understand what harm they're doing to their body when they do that. It basically causes poor mineral absorption. Remember, zinc and iron, calcium, they all need to be assimilated in an acid stomach to be absorbed into the system. It creates a vitamin B12 deficiency. The parietal cells in the stomach are the cells that produce the hydrochloric acid. They also produce the intrinsic factor. The intrinsic factor is necessary for you to absorb and assimilate the B12 that you get from your diet. If you're not making that intrinsic factor, you could be eating all the fermented foods you'd like and meat, but you're still not going to be able to assimilate those B12. Let's see, they can also cause parasites because the stomach acid, that hydrochloric acid, that's meant to destroy and burn and kill any parasites or any bacterial infections that might be in the food that you eat. You have insufficient hydrochloric acid, you have more of a tendency to foodborne illnesses and parasites. A candida infection, remember how I said it earlier in the last session that the gut needs to be acid in order for the good flora to thrive and grow and kill out any candida or fungal infections that might be going on. You take these acid blockers or antacid tablets, and now you can get a yeast infection because you've just alkalized your gut, and your gut needs to be more acid. Actually, the stomach's acid, the small intestines are slightly alkaline, but the bowel should be acid as well. You also get poor muscle tone and poor muscle strength simply from the inability to digest your protein that's needed by your muscles and also your heart. Remember, your heart is a muscle, and it can reflect all the muscles in your body as well. Long-term use of these antacid and acid blockers can lead to asthma, adrenal failure, exhaustion, hives, diabetes, rheumatoid arthritis, thyroid problems, and I should have added osteoporosis to this because remember, calcium can only get assimilated through an acid stomach. So what do we do to increase stomach acid? Well, as I said, you could do a betaine hydrochloride supplement. Sometimes I give it with digestive enzymes, other times I don't, depending on their needs. Bitter greens, your arugula, let's see, your kale, thank you, dandelion leaves, celandine, escarole, all of your bitter leafy green vegetables will basically encourage the stomach to produce hydrochloric acid. So that's why we eat a salad before every meal, and you should do it with romaine lettuce or the arugula, the kale, let's see, endive, escarole. These are your bitter greens, and that will get your stomach making hydrochloric acid. You can also do bitter herbs such as dandelion and the celandine. Like I said, you can add those to your greens, or you could take it in a liquid form. An aperitif, this is before dinner cordial, and they were always made from bitters to help the body produce more hydrochloric acid before you eat. One of the new ones that are out and are very popular are Jägermeister. That one is a bitter alcohol and aperitif that you can take. Also, you could do apple cider vinegar. I talk a lot about apple cider vinegar, but it's a great thing to do. And as I said, you could get Dr. Jarvis's book, folk medicine, and he talks a lot about the benefits of apple cider vinegar. If you're going to use apple cider vinegar, get the one that has the mother on the bottom, which is the culture, and that you'll find is very high in potassium, malic acid. There's a lot of minerals that can be found in apple cider vinegar again. Dr. Jarvis recommended taking 2 teaspoons of apple cider vinegar in warm water, mixing it with raw honey to taste, and doing that once or twice a day with meals. And I do that for a lot of my clients. If they say they like it, then I don't have to give them a hydrochloric acid supplement. They can just do that drink with every meal. Being a yogi, what I was taught when I first started practicing yoga is that they also do a morning tonic, only they take the apple cider vinegar and they mix it with maple syrup. Maple syrup will have a different array of trace minerals in it, and then they add a dash of cayenne pepper. That heat from the cayenne is vasodilating and allows the blood to circulate, especially to the extremities. And then we can take the same apple cider vinegar and test to see if you have any gastritis or gastric or duodenal ulcer going on. But for this test, you want to take that apple cider vinegar on an empty stomach, so 2 to 3 hours after a meal. You're going to take 2 tablespoons of apple cider vinegar this time and mix it with 2 tablespoons of water. You're going to note the time that you take it. And when you do this, I want you to have on hand one of those antacids I tell you not to take, or baking soda, because I don't want that burning sensation to continue. We need to give you, if you do have an ulcer, we need to get rid of it, or get rid of that burning sensation that you have. I tend to be a gentle healer. I don't want to hurt my clients when I'm treating them for anything or testing them for everything. So I just don't want you to feel pain if you do this test. But after you drink that 2 tablespoons of apple cider vinegar, if the pain occurs within 5 to 10 minutes, that's an indication of gastritis or an inflammation of the stomach lining or a stomach ulcer. If that pain occurs 30 minutes or later, that apple cider vinegar is out of your stomach and into the small intestines, so it's going to indicate an inflammation or a duodenal ulcer, an inflammation of the small intestines or a duodenal ulcer. If there's no pain that occurs, then there's no ulcer and no gastritis, and there's another reason why you have this pain or indigestion that might be going on in the stomach. If and when you do get that pain, I want you to then take the antacid to stop the pain, because that apple cider vinegar will continue to burn for hours until you dilute it or get rid of it. Or what you could do is just take a half a teaspoon of baking soda, mix it in 4 ounces of water, which is a half a cup, and drink that down, and that will stop that burning sensation. I'll also do that for people that tend to have gastritis. If the apple cider vinegar or the bitters are not helping, then that baking soda will sometimes relieve the indigestion that people get. So if you have an ulcer, what are you going to do? Thank you. The best thing is to juice fresh cabbage, and this has to be fresh. This was the old traditional remedy to get rid of ulcers, and it was because of the vitamin U, which we never hear about anymore, but somehow cabbage has it, but the FDA doesn't recognize it. But that will actually, drinking 8 ounces of that daily, and you can add a little apple juice if you don't like the taste of it, but that will get rid of your ulcer in a few weeks. What I do for my clients is I give them a fat-soluble chlorophyll, and it has to be fat-soluble, not the water-soluble. But taking it on an empty stomach, that chlorophyll that's very high in vitamin K will basically help stop the bleeding of a bleeding ulcer and the other fat-soluble vitamins will actually help heal the ulcer. Not only that, chlorophyll is a cell proliferator, which means that it encourages the body to make new lining cells of the intestines in this case. Also, vitamin A, C, and P, remember that combination, will knit tissue together and heal that ulcer. I'm going to give them a digestive enzyme. I start with one without hydrochloric acid because that hydrochloric acid will exacerbate that ulcer. So I just give them some digestive enzymes so that they can digest their food completely, take the stress off the stomach or the digestive tract, and then I can heal it. Licorice root is excellent to take for ulcers, but not if you have edema or high blood pressure. It's contraindicated. It can make it worse. But the licorice, besides being an adrenal adaptogen, is an anti-inflammatory. It's a demulcent, so it just soothes and heals that ulcer. Aloe or aloe vera is another great one you can take. It's an emollient. It's anti-ulcer, it's anti-inflammatory, it supports the immune system. However, taking too much aloe can cause loose stools or diarrhea. So you have to be careful about dosing that as well. I like using comfrey. Comfrey also is traditionally used to heal ulcers. However, comfrey is a cell proliferator. So about 10 or 15 years ago, the FDA asked all the supplement companies to take comfrey out of their supplements because they felt as a cell proliferator, it will proliferate any cancer that's going on in the body. Well, us herbalists have a completely different view on it. We know that by taking these whole herbs and not just herbal extracts, that they have natural buffers and a higher intelligence and won't proliferate cancer cells. However, to be safe, so I don't get into trouble, if there's any history of cancer, I don't use comfrey. I'll tend to use the licorice or the aloe or the chlorophyll or the vitamin U from the cabbage juice. Also, I'll have them eat those lactic acid I said lactic acid fermented foods, but you know what I'm talking about. It's the lacto-fermented foods is what I should have put in here. I'm sorry. And again, you want to do a half a cup with each meal. Or you can take a probiotic. That really will help take the stress off the digestive tract, assimilate your nutrients, and help you heal. Now,
okay, so testing. Okay, do you have 5 more minutes, my love?
Great, thank you. If it's due to H. pylori, you're going to have to add some immune system support. Again, that's in my book, but you know, vitamin C, zinc, echinacea, calcium, these are all things that you could use. However, to get rid of that ulcer long term, you have to find a way to reduce your stress because stress will exacerbate or cause an ulcer. So what I do is I add those nerve-relaxing trace minerals, calcium, magnesium, potassium, and iodine. These are found in alfalfa or kelp, so you could drink alfalfa tea, you can take kelp supplements, or you could just eat your seaweed, eat a lot of sushi. I also recommend relaxation and breathing exercises. What most people don't realize is the breath can control the mind. So if you slow down your breathing, your mind and your anxiety will diminish. So, but you need to, count your inhalations, make them long and steady, do a diaphragmatic and full lung breathing. Most people, as we get older, only breathe from our upper lungs, where the diaphragm is a muscle that sits right under the lungs that expands. And if you can expand that, it just sucks the air right in. So you really need to focus on breathing more from the diaphragm and filling up the lungs completely. And then you exhale very slowly, and just the opposite. It's like a glass of water. You fill the lungs from the bottom up, and when you exhale, you want to exhale from the top down. So you very slowly get rid of the air in the upper chest and the lower chest, and then you suck in the stomach or suck that diaphragm in, and that's how you exhale. But you want to do it to the same count. So if you breathe for 5 seconds in, you need to breathe for 5 seconds out, and it will control the mind and take away your anxiety and your stress. Other ways to do that is through meditation. If you choose to meditate, meditation is a great thing to do to help both the mind and the body. Let's finish up with acid-base testing. How much time do I have left? Okay, we're going to go through this fast, and there's a lot to do. I use pH strips, and I buy the type that do both the saliva and the urine, because it's easier. I can just carry one product instead of two. But again, I like to do it first thing upon rising. Before you put anything in your mouth or brush your teeth, you want to gather a pool of saliva on your tongue. You take out one of these strips, and on the tip of the strip, there's color bars. You dip that into the pool of the saliva, and then on the back of the bottle, it has a chart, and the colors tell you what your pH is. You do that with the first stream of urine in the morning. You can either capture it under in a glass, or you could just put another pH strip, not the same one you use, but a clean pH strip, and just put it under the urine flow. Then you want to record both of the readings, and you need to do this for 3 to 5 days, because some of the food that you're eating could be affecting your pH reading. So the saliva pH should be neutral on the pH scale, and that's 7.0 to 7.2. That reflects what the pH of the blood is in the other tissues in the body or fluids in the body. The urine pH needs to be acid. It should be 5.5 to 6.0, and that actually measures the pH of the gut or the stomach and the intestines. Some organs that are essential for acid-base regulation in the body are the kidneys. If the kidneys aren't functioning properly, your pH is going to be off. Also the adrenals, it regulates the sodium-potassium chloride balance, and the thyroid regulates the calcium-phosphorus ratio, calcium being alkaline and phosphorus being acid. With acidosis, you get a depletion of the bicarbonates in the blood. The tissue accumulates carbon dioxide. The oxygen in the blood can then not be utilized, and you get similar effects to deprivation of oxygen, so oxygen starvation. So some of these symptoms of suffocation might be frequent sighing, breathlessness, high altitude sickness or discomfort. We see this a lot in Colorado because of our high mountains. A dislike for closed rooms or not like being in an elevator, and also irregular breathing or respiration. It could also be signs of dehydration, dry skin, dry mouth, those dry, hard stools that come out like little pebbles, diminished urination, and also diminished perspiration. Or you can get symptoms of hyperirritability, such as tachycardia or that rapid heartbeat, photophobia or sensitivity to light, dysphagia or a hard time swallowing, restlessness, insomnia, cold sweats, or goosebumps that come easily. Another way is a breath test. This is how I test my clients from afar when we consult by phone. I have them hold their breath. A healthy person with a balanced pH in their body should be able to hold their breath for 60 seconds. If you can't hold your breath for 60 seconds, you probably have some acidosis going on if you don't have lung damage from pneumonia or smoking or something. So for acidosis, I'm going to give you alkalizing trace minerals such as kelp and alfalfa. I'll also give you a potassium bicarbonate. It's hard to find, but I did find an organic nursery. They use it for black spot or funguses on roses. And I've also been known to, when I can't get a supplement or a food, I'll go to other places to try to find it. But also sodium bicarbonate or baking soda is really great for acidosis. And the richest source of bicarbonates in the food is celery root, that's celiac, that people eat. Some other considerations is a carbamide powder. It buffers the blood salts. That B vitamin complex, especially the nerve stimulating B vitamins, because they're going to oxidize the lactic acid and the pyruvic acids in the body, get rid of them. And I'll give them kidney support, and I like to give them an arginase enzyme because it helps with the kidney overload, the chronic acidosis, especially if there's any edema involved. That's an indication of poor kidney function. Whereas symptoms of being too alkaline or alkalosis is calcium precipitation and deposits, so stones, spurs, spondylitis, any type of neurological pain because these calcium crystals leach out of the body when it becomes too alkaline, and they form at the nerve endings and create all this nerve pain. Also other types of calcium deficiency problems because remember, you need to have an acid stomach to digest and assimilate your calcium. Any type of joint stiffness, muscle cramps, night coughs, burning, itching, crawling sensation of the skin, thick blood, and rapid clotting time are signs of alkalosis. For alkalosis, I'm going to do that good old apple cider vinegar. Again, you could do Dr. Jarvis's toddy. Or I'll give calcium chloride salts. These are actually salts from the sea, but they're great acidifying chloride salts. You can also use your betaine hydrochloride, an orthophosphoric acid with naturally occurring inositol, or you can give them that vitamin G complex for acetic acid metabolism. In the back of my book, I also have a chart on foods that will alkalize or acidify the body. This is just one. It's a 2-page chart. I only put the first one on it. But again, that's another way to balance your pH in your body. Okay, so do we have any questions? We only have a few minutes.
Thank you so much, Donna Weil. This ends part 2, and you're welcome. She's willing to take some questions unless she wants to take a break or something.
No, I'm just, because we have to be out of this room, I was told, so if you have any questions.
Let's see, hold on. Well, no. Actually, right now it's a break, so we're cool. So if
great.
you know.
Then let's take some questions.
Okay. So then, we have to divide the microphone here. Yeah, why don't you guys come up here?
Yes.
Come line up here.
You use the mic so it
and
can
then
get on the recording, and I'll use the mic
I'll just put the mic on.
Thank you all for coming.
Thank you. Bravo. We love you.
And enjoy the rest of your conference. I will be at the booth after this selling my book. If you'd like any of these tests, I'll be able to do them first thing in the morning, and I'll be here for the morning book signing as well, and then I have to leave, so I won't be here in the afternoon. Okay? So thank you.
Thank you. Okay, we have first question here.
So you talked about not using glandulars too long because it can prevent your body from
It's actually only desiccated glands. Okay, so you could use desiccated liver, you could use desiccated heart, But desiccated adrenal or desiccated thyroid is going to give you those hormones, and it's going to shut down the body's production of its own hormones. So I usually only use them 3 to 6 months while I'm building the organs. Now, some people need to stay on desiccated thyroid, like Armour thyroid, but I also use the nutrients along with it to help build their thyroid.
Okay, so if we're eating desiccated liver as a source of regular liver, is that you're saying that's different?
Desiccated liver will not shut down liver production. It's only for the glands, not the organs. Thank you for that clarification.
So you talked about the apple cider vinegar and then curbing that with baking soda, but when I do that at home, it just bubbles. What does that do in our gut?
You're basically doing the baking soda afterwards, and those bubbles are breaking up the acid, basically. So, yes, but you're taking it after you've done the test just to staunch the burning. Yes. I don't recommend you doing both at the same time, only for that test, okay?
I wondered about floaters and little purple red spots that appear only in this area on the... What was the first one? Floaters in the eye.
Floaters in the eyes come from stress. When people are under stress, they get those floaters. So I give them the G complex and nerve relaxing trace minerals, do the breathing exercises, do the meditation, and that will help with your floaters, okay? Because you have to get rid of the stress. Now, what's the purple that's going on your thigh? Is it broken capillaries? Okay, do you do hormones? Are you on birth control? Because birth control can cause that. So those estrogen and progesterones, it's on him. Probably broken capillaries. You'll need to give him the vitamin C and P complex, which are in your most colorful fruits and vegetables. So your reds, your purples, those will have what you need to strengthen those capillary walls. And any type of capillary fragility is a C and P deficiency. You're welcome. And if it doesn't help, grab my card and call me.
I just wanted to say I think lack of sleep also causes the floaters, because that happens to me.
Yes, because remember, lack of sleep causes stress.
Exactly.
So to heal ulcers, you recommended comfrey. So from a comfrey plant, what parts do you use and how do you process it?
I do the comfrey leaf, and you can also do the rib that's in the leaf as well. You can break it up and put it into your salads. You can put it into your fruit smoothies in the morning, juicing it, or you can make a comfrey tea out of it. It's more in the leaf than the root. Okay, so you want to use the leaf for the ulcers, okay? Good question. I should have said that.
So for somebody that has like a copper IUD as a birth control alternative to the oral contraceptives, would the copper affect the metabolism of other minerals in the body just by being there?
That's a great question, and I can only guess about the answer. So if you have a copper IUD, and I did as well, because it's a good form of birth control, and I never thought, but yes, the copper might be getting absorbed, but only if it's acid, in an acid environment. What I would recommend for you to do is do a zinc taste test, and then we would know if you were getting too much copper, because the copper would depress the zinc. So the way to do it is to see if you're adequate in zinc status. But no, I never heard anything about that and never thought about it. So it's a good question, but check your zinc levels. That will be a way to monitor that, okay?
Sure. And then also, if you see, do you ever see patients that have like just horizontal dents in the thumbnails?
That's bowlines, and I talked about that last year. I did the tongue and fingernails at this convention, yes. So what I would recommend, bowlines could be a number of things. There's a list in my book, about 12 things long, that could cause those. So stop by the booth, take a look at my book, and see if you have any of those things going on, okay? Or you could purchase it.
Exactly.
I've been having a lot of pain in my joints, like wrists and not being able to open jars, shoulders, knees hurting, hips hurting.
Okay, that could be symptoms of alkalosis. Remember, I talked about joint pain being symptoms of alkalosis, so do a pH test. Also, that could be signs of starting some arthritis. So, eat a very good diet with lots of raw fruits and vegetables to help that. And if neither of those help, give me a call or email me and we'll figure it out, okay? Because a lot of these signs and symptoms could be other things. Unless I do a full history and assessment on you, I can't always guess just with one question, okay?
Thank you so much. You mentioned calcium supplements. How do you like people to take calcium?
I basically tell them it's best taken on an empty stomach. And it's best taken frequently throughout the day. However, I know myself and a lot of my clients, we only take our supplements once a day. I'm too busy, and unless I'm hurting or sick, I don't think about taking those supplements. So I usually take my supplements first thing in the morning all at once. However, for Charlie horses or muscle cramps during the night, or for sleep problems, I have my clients take their calcium supplements 1 hour before bed. So that's another time that you can take it if you have any of those problems. Yes, a tablet. Oh, I'd have to look on the bottle. Okay.
Okay, last question here.
You talked about diaper rash in babies and rashes. How would you recommend supplementing a baby?
With how old is the infant? Okay, are you breastfeeding? Okay, because if the mother is breastfeeding, the best way to get the supplements into the child is to give them to the mother. Okay, if you said how old? 2.5? Okay, and what were you looking to get into them? A probiotic. Okay. So what I would do is you could get a probiotic in a capsule, open it up, mix it with a little applesauce, and give it to them. Or you can mix it with a little water, or in the pharmacy department you can get probiotics that are actually in a powdered form. They need to be kept refrigerated, though. And that's the way I used to give them to my children. The other thing is, you could give yogurt to a 6-month-old baby. So you should be giving that child yogurt every day. Is he eating sauerkraut and other fermented foods? Make sure 3 times a day with every meal he's getting a little fermented food to help with that. But also look at a probiotic to stop that diaper rash, okay? Also, disposable diapers are really good at causing diaper rash because basically it can't breathe, so you might want to switch to cloth diapers, okay? You're welcome.
Or the organic diaper. There's 2 more, actually. Okay, come on.
So you talked a lot about stomach acid being very, very beneficial. What would you say for drinking alkaline water? Does that adversely affect health? Or?
I only recommend that alkalizing water after you take your pH and make sure that you're too acid. I get upset when people take acid or that alkaline water. Yes, well, even taking other acids without taking their pH first. So you can basically go on the internet, buy these, and I would suggest taking your pH because you don't want to become too alkaline from drinking those alkaline waters. But if you tend to be acidic, those alkaline waters would be beneficial.
Last question, I hope.
I'm a muscle cramp or Charlie horse issue, and I'm getting the idea that it could just as much be not enough magnesium as a calcium.
It could. It could be a magnesium. It could be calcium. It could be lack of vitamin F or the vitamin K2. It could be lack of vitamin D, getting the calcium from your stomach into the blood as well. So you're going to have to experiment, or I'm going to have to do a full follow-up with you so that I can figure out, look at your diet and tell you where you're deficient. And that's one of my fortes. I can look at anybody's diet, ask them what they're eating, and tell them what they should be eating, what's out of balance, and what they need to add. So we'd have to do a lot more questions to answer that. Okay? You're welcome.
Bravo, Donna. Wow, thank you so much.